Hello, are you there?
We're going live in 2 minutes. Kindly share the video. Kindly invite your friends to join Ask the Pediatrician annual online conference. And today is day 2. So this is the time for you to invite friends. This is the time for you to join us. So we're going to be starting very soon. Please share the videos on your timeline. Share it with your friends. And our speakers already in the studio. Thank you. Okay, good evening, everyone. You're welcome to Ask the Pediatrician, our second online conference. And today is day 2. And for those of you that joined us yesterday, I believe that you really had a wonderful time. And today, again, we're having 3 speakers, and they're going to be talking on various topics about child health. We're going to have one of our speakers talking about poisoning in childhood. And already I have Dr. Moyo with me in the studio. And after that, Dr. OLATOSI will be talking to us about pediatric dental emergencies. And then finally, one of our pediatricians also talking to us about cardiopulmonary resuscitation in childhood. So this is the time for you to kindly invite your friends and invite your neighbors, share the video link. Just click on the share button. You can share to your friends. You can share on your timeline so that we can have more people joining us. As usual, we're going to first listen to the speaker for about 30 minutes, and then you can drop your questions for us in the comment section, and then we will be able to take them during the question and answer time. So I hope you will have a wonderful time to us today. So I am bringing in our speakers for today, and that's Dr. OLIBAMOYO, who is pediatrician, and we just finished at Lagos University Teaching Hospital, and she's going to be talking to us about childhood poisoning. Dr. OLIBAMOYO, you're welcome.
Hello, good evening, ma. Good evening, Dr. Boyede. Good evening, everyone who is. I'm Dr. OLIBAMOYO. Like Dr. Boyede said, she's a big auntie and we want to do childhood poisoning. So I would implore all to get online to not just interesting. It's a of something that is very preventable, and if it's not prevented, it can cause not just death but significant what we term morbidity, disability, apart from death, and could also impact the family. So it may even cause and all that. So this topic I'm going to talk about today is accidental poisoning in childhood. Now, when we say accidental poisoning in childhood, it's all about a child that comes in contact with something that is poisonous, or let's say has the poison and cause some significant. Now they become the substance, or even the substance coming in contact with the skin of that child. And who are we talking about? What age groups are we talking about in this case? We're talking about children, and it's more to touch everything around them, to explore everything available around them, and as a result of that, they can come in contact with this substance. The onus comes on us, the parents, to be watchful of these children and to be careful of these children. And it's a lot of work. Especially, I'm a mother, and I can tell you work, especially when you have maybe more than one or two children in that age range. But it could also occur in older children, although we may not really say it's accidental. It could be due to maybe they feel they are neglected, especially those adolescents. All those adolescents that are like their parents are not giving them freedom. They are not allowing them what they want to do and all of that. And so as a result, they want to gain some attention. They want to, and then as a result of getting some of these substances, accidents. So also reach out to preventing these of children, adolescents, and the older group from having contact with it. What are these substances? We may say these substances, it can be drugs, can be household. That's even the most common. We see at the hospital, tin and drank bleach or kerosene. There are different types, and especially in our locality, not these local pesticides and sniper. Really, a lot of children have liquid soaps, all those ones that they just put in bottles that look like water. The child just goes there thinking it's water. Even methylated spirit. There are different types. Then for the medicines, the drugs, children, they are attracted to very colorful items. So we have things like bright red, attractive tablets that are like those iron tablets. When we are pregnant, those tablets those yellow tablets, folic complex, all those brightly colored tablets just pop mouth and then come down with problems. Other types of poisonings can be from generator fumes. Now, we may not really, unconsciously or consciously, we may think the generator is very, very, is harmless. But you see, the fumes from that generator, it can kill even an adult, not talk about a child. So we're going to talk about part of our prevention today will be about how to avoid those substances from getting to the children. To the children. What are the signs of how can you say that this child has taken oh, mommy, most times the child are missing. What happened? Looks around and sees that the child's mouth is discolored with the color of that drug, and then the parent now raises, and then most of these signs, they could be moderate, and some of them could also be severe or life-threatening. These mild signs can include maybe minor burns or scar, or even from this alkaline solution, the type that they use for making soap, sodium, they call it sodium hydroxide. Maybe if the child
Okay. We apologize. We seem to have lost our speakers, but I'm sure she will come back very soon. Thank you so much. Okay, Dr. OLIBAMOYO is back. Hello, Dr. OLIBAMOYO. Okay, Dr. OLIBAMOYO is talking to us about poisoning in childhood, and she's just going through the signs. We apologize for some of the quality of the production. Okay, Dr. OLIBAMOYO, you're back. Can you continue?
yes.
Thank you.
Okay. May include the fact that the child may have odors from mouth or nose, which may not be what child takes kerosene. The child takes kerosene. You just get out and then you see kerosene from the child's mouth. That may give you a warning. Oh, this child has drank that shouldn't have been taken. Medical things. Now, what's mild sign? Now, that could be life threatening, that could be life threatening, not well handled. Imagine or child from slow that one sleeps and or or the child's color has changed and the child looks pale all of a sudden, looks pale all of a sudden, is not talking, is the child is not well, and may be breathing too fast, or the child or at all, we read some certain substances can, you see such situations, when you see such situations as a caregiver or as a mother, the first thing, the first reaction should maybe to raise alarm. Now, all these are dangerous and can even state of the child and can cause death of the child, which we don't want. So what do we want to do? The first thing, first of all, you are calm, because if you are not calm, things that you must take it away from the child, or take the child away from it. Thing you should do. The top is not to give the child anything to drink. It's very common. The mother took something and was convulsing, So don't give the child anything. Please, mothers, I'm also begging you also, don't insert anything into the child's mouth. Some people may want to put spoons, some might put onions, some might put butter, all sorts. We've seen all sorts in our pediatric practice. Please, two major points here. Don't give him to drink and do anything whatsoever into the child's mouth. Now, like I said earlier, give the child anything to drink. People will come up with all sorts. In our locality, everybody seems to own. Everybody has his own solution for something. All sorts of things we hear mothers give. Palm oil, that's the number one culprit. So please don't give palm oil whatsoever. Don't give palm oil. I can say over and over again, do not give palm oil child, because child may aspirate. The palm oil, instead of going to the palm oil, is as dangerous ever. In fact, palm oil and the line to exchange to the system. How I can go on to have severe problems, respiratory problems, in extreme line, going to the intensive care unit. The child may even die from that. Don't want to give palm oil. So mothers, I'm still begging you, you have to urinate in the mouth. This is there is no God knows that.
Okay, we seem to be losing Dr. OLIBAMOYO. I think the network is quite poor. We apologize for that. And what I would just do, because I don't want you guys to lose the train of the presentation, since she has sent to us a presentation, what I would do is to just complete the presentation on her behalf. So basically, Dr. OLIBAMOYO was talking about childhood poisoning, and she's already told us all the various things and by way which children can things that can create poisoning in children. And she has now gone further to be telling us what we need to do as parents. And what she's telling us is that as parents, we should not panic when your child has, I know this is a very tall order for most parents, and it could be quite difficult for us to follow, but basically please do not panic when children have got, no matter what, because in the process of panicking, you could actually create more problems for that child. And in that process, I mean, the things can go wrong. But the emphasis is also some of those things that we tend to do as parents. People tend to do a lot of things. Especially in the Yoruba culture, we believe that epo pupa, palm oil, is error, which means that once a child has taken any poison, the first thing people reach out for is palm oil, and they want to give the children palm oil. And in the process of doing that, we actually, the palm oil that's the wrong. I mean, that's the worst thing we can do. And for those of you who are familiar with ACP, you remember I actually did a write-up about a child who died because the palm oil was given to the child. And it is not the poison initially that actually killed the child itself. It is actually the palm oil that was eventually given to the child during that process, and that is what actually led to the death of that child. And so what we are saying basically is that we don't want you to be giving palm oil to children. You don't give them anything like that, because the children can inhale the palm oil and it will go into their lungs and cause more damage to the lungs. So this is something you want to avoid in children. Don't also insert things in their mouth, because some parents are trying to say, I want to make the child to vomit, and in the process of trying to make the child to vomit, you are giving things that are you are trying to put this in their mouth and all that. Sometimes some of those things you're trying to do will create small problems for the child. So you want to avoid doing that as well. And what you say, what Dr. OLIBAMOYO is saying is that please take these children to the hospital. Take them to the closest hospital to you. I think you are beginning to see a pattern in all these childhood emergencies. Is the fact that, number one, be calm, and number two, you want to go to hospital immediately. Once you have an emergency, you want to go to the hospital immediately. And then whenever you are going to the hospital, take along with you whatever that child was may have taken. In other words, if the child took snipper or whatever kerosene, just go, because sometimes the doctors want to know what the child has ingested, and in the process, that may help us to know what kind of antidote we need to give. But if you don't go, because parents will just come, I just sent with this tablet. What's the name of the tablet? What's the name of the medication? The parents don't know, and you are not really, that information is not helpful to the pediatrician when you just tell them the child has ingested tablets and all that. But we really need you to come along with you with that particular medication that the child has taken. And when you get to the hospital, then the pediatricians will know what to do. And like I mentioned at the opening ceremony period, when I was given the keynote address, there's a golden hour. Once children ingest poison, we want to see them within the first 1 hour, because if you bring them to us within the first 1 hour, we could do a lot more. We could, try and bring out the poison out of the child's system. And when we do that, then before it gets absorbed into the bloodstream, we can quickly do that. But if you bring them after, like, say, 2 hours, 6 hours, sometimes the poison has been absorbed into the system, and it's quite more difficult to bring it out. And sometimes what we can now do is to just support the child as much as possible. And there are some things that, there's some poison that are very corrosive, and sometimes we just need to give neutralizing substance, things like that. So, but the key thing for us is the fact that you need to bring the child into the hospital as soon as possible. And more importantly, is the prevention. We need to focus on prevention, and that's the essence of this conference, that we need to prevent children from having poison. Because sometimes, no matter what we do, we may not be able to save the child. Because so the best thing is prevention. In other words, let it not even happen in the first place. And how do we prevent it? Number one, from Dr. OLIBAMOYO's slide, he said keep all medicine out of the children. I'm sure most time parents hear that a lot, but they don't understand what it means. They just see it as one of those rhetorics, things we are just used to hearing all the time. So it's just a rhetoric, but you should keep all medicine out of the reach of children, because all medicines are poison. even your vitamin C, all medicine have poison. So you want to keep all medicine out of the reach of children. So they should be in cupboards, they should be locked, they should be way up there. Not something that children, sometimes parents, we are a little bit careless with our medication. You are taking a medication for something and you just take your medication, you leave it on the table and you slept off. And your 2-year, 3-year-olds, they're very curious. They are going to just grab a hold of that medication. They're going to open, they're going to take it up, and that will lead to that. So when we're saying keep medicine out of reach of children, make sure they are tightly sealed. There are child way of child-proofing your home and all that. That's basically what Dr. OLIBAMOYO is saying. And such medicine should only be in cupboards that only you or other adults have access to. Please, this picture that we are seeing on our slide where a child is playing with medication, it is not going to happen at all. We need to make sure that we make sure our homes are child-proofed, and these are very important. And just like Dr. Rena also said yesterday, make sure that you don't keep things in a place where children can easily reach them. You want to keep things away from children. These are very, 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 very important things that you also want to do. Make sure you don't put your bleach, your kerosene, don't put them in containers for water, because children don't get that. When they see it, they don't know that this is kerosene. They just take it as water. They will drink it, or they may think it's Sprite. They may think it's another drink, and they just want to try. So these are some of the things that sometimes we as parents will be very careless about, and we just need to make sure all things are in the right container and properly labeled, and you want to avoid that. So basically, that's what our presenter is saying. Please don't use medicine in the presence of children, because they may also want to try it after you. And for the older children, be very alert. Be a friend to them, so that you know when they have said, to try to take your own medication and things like that. So basically, that's what uh, our presenter is saying. So because of the audio, that's why I put Dr. OLIBAMOYO down. We're very sorry for that, but I'll bring her up now.
Yeah.
Dr.
Okay.
OLIBAMOYO, sorry, I have to help you with your presentation to the end, because
Yes, thank you very much, ma.
the audio is quite bad and many people are not getting it. So, I mean, I just have to do that. But let's see whether we can try and take your questions and whether we can flow. Again, as we are going to start
All
taking
right, ma.
questions, I think your audio is better now. As we're going to take questions now,
Yes.
kindly make sure that you ask relevant questions. Please don't ask questions that are not about poisoning or pediatric emergencies. We will not be able to take them. If you have any of those kind of questions, we plead with you to kindly go and post it on the group. Post it on the group, and our moderators will address them. We want you to only ask questions that are relevant to the presentation. We really, really were pleading with you. So if you have any of those other questions, I'm so sorry, I won't take them. Ekene, Ebenua, you've been asking a lot of questions about cough, catarrh, and all that. Sorry, we won't be able to take that question. Kindly post your question on the group, and it will be answered there. Thank you very much. Babalola is asking about breastfeeding. Kindly go and post your question on the group, and it will be answered there. This is a presentation about childhood poisoning, and that is what we want to hear. Question we will be answering. And Okpeyemi is commending us for a job well done. Thank you. And Precious is also commending us. Can you please send us your questions so that we can take them? Thank you so much. Okay, so Dr. OLIBAMOYO, if I can ask on behalf of the mothers,
Yes.
why don't you want them to use palm oil? After all, some others say that's how our grandparents and our great-great-grandparents, that's what they've been doing. So anytime they see that is our error. It's an antidote to all poison. So why don't you want the mother to use? Yes.
Okay, well, I explained earlier, but I guess I got cut off, ma. Well, like I said, palm oil on its own doesn't have any problem. But in trying to force the child, remember the child has taken something that has irritated him or her. Now you're now forcing the child. You're basically forcing the child to take palm oil, and the child will, in forcing the child may cough up some of that palm oil, and then some of that palm oil gets into the lungs. And by getting into the lungs, like I explained earlier, the lungs and palm oil, they are like North Pole and South Pole. They are things that should never come in contact with each other. Now, when it comes when palm oil gets in contact with the lungs, the lining of the lungs, which is where the lungs is meant for air, it's not meant for any form of liquid at all. So when the lungs come in contact with palm oil, it irritates the lining of the lungs and causes what we call inflammation. The lining of the lungs then reacts to it, and the child gets what we call chemical pneumonitis or lipoid pneumonia, and thereafter in severe respiratory failure, it can even cause death in that child. It can cause more problems than the poison itself. So we don't even want to give palm oil at all. That's basically the reason why we don't want to give palm oil to these children. It can cause more problems than even the poison itself.
Okay, thank you, Dr. OLIBAMOYO. Yeah, okay. So we're still taking your question. Kafaya Sajadi say, kudos to you guys. May God reward you. Thank you. Yeah, we can hear you, Dr. OLIBAMOYO. So, why, Dr. OLIBAMOYO, which of the poisoning is the commonest of all the poisoning that we tend to get in children? Which one is the commonest? From your experience as a pediatrician. Dr. OLIBAMOYO, did you hear me? Okay, Gloria is just joining us and is saying, yippee, another great presentation. Thank you, Gloria. We appreciate that. Dr. OLIBAMOYO,
Okay.
are you with me? Okay, so let's move on. Okay, so we have a question here. Dr. OLIBAMOYO, are you back with us?
Okay.
Are you with me? Okay. Odunayo Ilesomi Alade is asking a question. If a child mistakenly took poison and where the parents stay is not close to any hospital, are you getting the question?
Yes, I am. Yes, I am.
Okay, your health center. Is there any first aid treatment that can be done at home before taking the child to the hospital? Did you get a question? In other words, if a poisoning incident has happened and the hospital is far away, what can the mom still do before taking the child to the hospital? Yeah.
Well, in that case, I would advise. Well, I would advise that, like I said earlier, you take the child away from the take the poison away from the child, and if it's on the skin, try to wash it off with water. If the child has inhaled, the child just needs to get to a hospital. There is no two way about it. The child needs to get to a hospital, but the basic thing you can do is just take the poison away from the child, and then if it's on the skin, you can wash it off, and that's just the child just needs to get to a hospital. There is really nothing much you can do as first aid in the house for that child.
Okay,
there's really nothing much.
Yeah, I agree with you, Dr. OLIBAMOYO. So, Odunayo, basically, when it comes to poison, you really need to be fast. And I don't always get when people say, I don't always get when people say the hospital is too far away. The hospital the ideal thing is that within 30 minutes you should be able to get to the advanced hospital. Ideally, within 2 or 3 streets away from you, you should have an health center. But I know health centers.
Exactly.
Exactly, but I know health center may not open at night. But even if it's a private hospital
Yeah.
or anything, it doesn't matter. Take the child to the hospital, let them do the first aid, then they can transfer. Many people always want to use this excuse of the hospital is too far away. In an emergency, nothing is too far. You just have to do the right thing and
Yeah.
make sure you take your child to the hospital. Thank you.
Exactly, ma'am.
Yeah. Gloria is asking, Doctor, when bathing a child and the bathing soap enter the child's mouth, is that considered
Mouth. Okay.
poisoning? Dr. OLIBAMOYO,
Well,
the soap from water.
well, the soap, the soap, the bathing soap or the bathing water,
The
it
bathing
shouldn't
soap,
be considered
the
as
foam, the
poison.
foam, the foam.
That's the foam. Yes, yes.
Mm.
It shouldn't be. In fact, most of those soaps they are kind of designed in a way because the manufacturers they kind of they are preempted. They know that this can happen, so it shouldn't be. But the problem will arise if the child has taken a large amount. A
Yeah.
large amount. So in that case, is when the child has gone and eating, really eating the soap, maybe like half or 1/3 of the bar of the soap, then you know that okay, yes, this is poisoning. But when a little of it just entered the baby's mouth, no, it shouldn't cause any form of alarm for the mother or the child. But another thing we should do, I know Dr. Bede has posted something about bathing a child. Somebody asked a question sometime last year about how to bath a child, and I know she gave a thorough step-by-step method of how to bathe a child. When bathing babies, is best to face towel that is used is squeezed dry after rubbing on the soap and pressing and putting inside water. Squeeze it dry before rubbing it on the child's face, so that in that way there is limited the child's risk of swallowing the soap or even inhaling the soap is highly limited and reduced to the barest minimum.
Okay, so basically, as a mom, if you are really bathing your baby properly, you should not pour water
Yeah.
and pour soap on the face in that way. You are not supposed to even wash the face in the way that the soap will be getting to the mouth. You're supposed to just rub the face a little at a time and then use
Yes.
your face towel and just wipe. If you do it that way, there is no way the baby's mouth soap will enter. And it's
Soap
because most of you
enter
pour
the mouth.
water and you are pouring soap, and it is a very dangerous thing because that child can actually aspirate.
Very dangerous.
It's not even the soap entering
Yes.
the mouth that is the most challenging difficulty you're going to have in such a baby. The most challenging thing
Yeah.
you're going to have is aspiration. The baby can actually take the water the
Yes.
wrong way, and we've seen that. And that is why when you're bathing baby, we call it segmental bathing. You do the face separately, you wash the hair separately, you wash the hair backwards, the way you women wash your hair in the salon, so that it doesn't fall on the face. So you're not supposed to pour water over the face and all that. Please, maybe we'll take that as another presentation another day completely. Thank you so much. Monica is saying nice, nice. Thank you so much, Monica. Olawumi is saying my son has white patches on. No, Olawumi, can you kindly post that on Ask Pediatrician Facebook group? This is about childhood poisoning. If you post all your questions on Ask the Pediatrician Facebook group, we will try and answer them. So just send us questions about um, childhood poisoning and about pediatric emergencies. This is a specific conference about that, and those are the kind of questions that we would really like to take at this time. All right, thank you so much. So Dr. OLIBAMOYO,
Yes, ma'am.
I was asking you before, but it's like you didn't get that question. What is the commonest form of poison that we get in children? I mean, from your experience in Lagos, in Nigeria,
Okay.
what kind of poison is the commonest that we tend to get?
Well, there are two most common form of poisonings that we get, and the first is this kerosene.
Kerosene poison.
Most
Yeah.
kerosene is the
Yes.
culprit, kerosene, because
Yes.
it's colorless. Well, I won't say odorless, but it's colorless, and so
It's
these
colorless, and
children
most
see it
Nigerian
and like
mothers
this,
put it in their ever
and then
water
it is they
bottle.
put it in plain bottles.
Yes,
Exactly,
or Coke
they put it
bottle
in
or
plain
Fanta
bottles, and so
bottle.
the exactly, and it's within the reach of the child. So They just think, wow, the child just looks at it and like, this is water to drink, or this is Sprite to drink, and the child just takes it. That's the most common. The next one after that in my practice, my practice so far, is sniper. I don't know if we know about sniper.
Yes, we're beginning to have a lot of sniper poisoning, and it's so deadly.
Yes,
it's so deadly.
It's rising. It's rising.
Yeah.
Yes, it's deadly because it can irritate not just the airway but also the stomach, and then even cause it can cause burns to the pathway that leads to the stomach, and then these burns, when they heal, they come together, and in a way, in layman's word, it shrinks that pathway that gets to this, that takes in food, through which food passes down to the stomach, and then can cause significant problems for these children. You know, so the first one, kerosene, then this sniper is getting, the incidence is rising. Occasionally, not very infrequently, we see bleach. We see that of bleach, but it's not as common as the other two that I've earlier mentioned.
Yeah, and what is the major problem with those kind of bleach and batteries? You didn't mention battery, because children hit a lot of batteries and all those acid batteries that are lying around. Well, they put it in their mouths. I've seen children
I actually
bite through it, chew through it, and get to the acid. These things happen, and sometimes parents, we really need to make sure we don't allow such to happen.
Yeah, well, Dr. Rena talked about batteries yesterday, so that's why I kind of omitted it.
There's an overlap between aspiration and poisoning because they tend to overlap a lot. Yes, I agree with you.
So that's why I omitted it. Well, that's another very common form. This alkaline, they call it alkaline batteries, the type that you see in wristwatches. These children, because it's so small, it's metallic, it looks attractive, the child just swallows it, and the parent or caregiver never knows. In fact, in some cases, it can just in the part where food in the lungs. It can be there for months before them with bleach. Major rises, or let's say complication that arises, is that they corrode the lining of either the lungs or the lining of the esophagus. Esophagus is the pathway that through which food passes from the mouth to the stomach. So it corrodes it, and then the body now reacts by trying to heal itself. And in healing itself, it can shrink and cause what we call fibrosis. And then the child starts having difficulty, swallowing. The child can't swallow solid.
Yeah, thank you, Dr. OLIBAMOYO. So basically what we're saying is that the poisoning is not just like only when it is absorbed into the system. The poisoning can also due to
problem with bleach is that it's
okay. I think Dr. OLIBAMOYO, your internet is acting up again. All right. So we're still on. Kindly send in your questions, and very soon we're going to be having Dr. Buki OLATOSI joining us, and she's going to be talking about pediatric dental emergencies. So we expect your questions. Kindly send in your questions to her. Thank you so much. Okay, we seem not to be having lots of questions today. Okay, so if you have questions on pediatric emergencies, you can send your questions to us as comments, and we'll be happy to take them. We're still on the Ask the Pediatrician conference, and today is our day 2, and this is just to let you know that for those of you that mixed the one yesterday, you can actually watch it on our page, Ask the Pediatrician Foundation page. You can also watch it on our group, Ask the Pediatrician group, or you can actually watch it on our YouTube channel, Ask the Pediatrician. So if you go through any of this, you can listen to all the wonderful presentation we had yesterday. And today, Dr. OLIBAMOYO has talked to us about childhood poisoning. And what basically I'm just going to do in the next few minutes as we begin to round up is to summarize what she has taught us today. And just to say that a lot of children die needlessly from childhood poisoning. And the reason why children die from childhood poisoning is because children are very adventurous, especially children below the age of 5, and yet they don't know, what is poison from what is not poison. And just to let us know that every drug that you have in your house, even though you think it's a normal drug, it's poison, because depending on the dose, even your paracetamol can be a poison if the child takes a whole. And I've seen parents ask me, the child finish a whole bottle of vitamin C, what can they do and all that. And what we're saying is that keep those medications out of reach of children. It's not just a catchphrase. It's not just something that you just want to use only when you need it, but you need to keep medication out of the reach of children. And that's basically what we're saying. And also, apart from that, all those other substances that, like kerosene, many of us were very guilty. We put it in our ever bottle water. We put it in our soft drink bottles. Those kind of things, we see a lot of children taking them because the children don't know that those things are not food or drinks. The children take them, and sometimes they end up with poison, and kerosene poison is quite common, especially in this part of the world. So we say keep those things away from children, keep things in their proper bottle and properly labeled and probably locked away in cupboards with keys that children cannot reach. It's very, very important, because no matter what the pediatricians do, sometimes we may not be able to save the child, but if you prevent it in the first place, that is the best thing to do for the children. So try and prevent childhood poisoning, and by keeping all those things away. And we're saying that if for adventure, despite all your efforts, children get poisoned, the best thing to do is to take the children to the hospital. We're saying please don't force them to vomit. Please don't give them palm oil. I know it's a very popular practice. Please don't do it, because children can actually inhale the palm oil and develop what we call pneumonia, and that is a very terrible pneumonia to treat. And most children will need intensive care, and sometimes we will lose the children, not from even the poisoning itself, but maybe from the palm oil that they have now inhaled. So we say don't do that. If the children are taking kerosene or anything, I know everybody in the community will say, oh yeah, go and get. Please tell them no. The best thing you can do is to take the child to the hospital, and when you get to the hospital, the pediatricians or the emergency room doctors will examine the child, and depending on the findings, if this quantity is not so much, sometimes like in kerosene poisoning, we may not need to do anything else rather than just to observe the child to know whether the child is going to develop complications, because it can affect virtually any organ of the body. And after 6 hours, if the child is not having fast breathing, difficulty with breathing, and all those things, we may think, oh, this is not a major one. But some children, if they have all those other symptoms that shows that other organs have been affected, then we may need to send the children to for supportive management and things like that. But don't assume, oh, the hospital is too far away, I will go in the morning. Like we have been saying, emergency is an emergency. When something is an emergency, it means it should be treated immediately. If you are living in those parts of the world where they have what we call poison centers, please kindly make sure that you know the phone number of your poison centers that you can call. And so some of you, if you once you call the poison center, they will be able to give you the right advice, and once you put in that advice, and that will be all. But if you are not living in those kind of countries where you can call the poison center, please take the child to the hospital. And when you're taking the child to the hospital, kindly go with the medication or whatever substance that child may have ingested. It could have been the drug, the bottle of the drug. Don't say, because sometimes the worst thing you do is when what did the child take? You say it's small medication. What's the name of the medication? You don't know. But if you have gone with the bottle and all that, then it is easier for the pediatrician, because some of those medicine, for example, has what we call antidotes. and most emergency room will store those antidotes. So we know if a child has taken aspirin, for example, we know what to give. If the child has taken too much of paracetamol, we know we have antidotes to give for that. But if you didn't go with those bottles or your own medication that the child has taken, we will not know which antidote to give. And so basically that's what we're saying. Make sure that the child you have the antidote that you can give to the child. So I mean, make sure you go with the drugs. Sorry, I beg your pardon. Go with the drugs to the hospital. The pediatricians will be able to now give the right antidotes if available. Not all the time we have antidotes available, but when available, we can give it to the child. So basically, that's just a summary of this presentation that we have been doing. And we're going to be rounding up very soon and having our next presenter. If you still have your questions, you can still send us your question now and we will be able to take them. Thank you so much for those of you who are just joining us. We still have 2 more presentations, and the next presenter will be Dr. OLATOSI, and she will be talking to us about pediatric dental emergencies. And so we want you to quickly join us, as Dr. Latosi will be coming up very soon, and she will be talking about dental emergencies. So we have we seem to have finished a little bit early for pediatric the poisoning in childhood today. I guess maybe because we have lots of our internet connection was quite challenging today. But just to say that Dr. Latosi is coming up very soon now, and she will be talking to us about Dr. Latosi will be talking to us about pediatric dental emergencies. We implore you to try and join us for that presentation very soon. So we're just getting ready to start. Okay, so yes, okay, so we have Dr. Lotosi is in the house. Right, so let me just bring Dr. Lotosi up. And Dr. Lotosi is going to be talking to us about pediatric dental emergencies. And this is to say that Dr. Latosi is a consultant pediatric dentist at the Lagos University Teaching Hospital, and she's also a senior lecturer in the Faculty of Dental Sciences at the University of Lagos. And so it's a pleasure, it's an honor for us to have Dr. Latosi talking to us today. Dr. Latosi, you're welcome to our Ask the Pediatrician annual conference. Thank you so much for joining us.
Thank you very much. It's great to be here. I'd like to wish everyone a happy anniversary. All the mothers in the house, fathers, grandparents, uncles and aunties, a happy anniversary.
Thank
And I
you
want
so
to
much.
congratulate our founder, the founder of Ask the Pediatrician, Dr. Gbemi Boyede, on this beautiful innovation. The
Thank you
Lord
so much.
continue to strengthen you.
Amen.
So today we'll be talking about dental emergencies in pediatric patients. And this is a very important topic that relates to everyone who takes care of children, and that includes teachers, parents, health caregivers, nurses, everyone who is in charge of taking care of a child. So we'll go straight to the point. There are so many dental emergencies, and problems, emergencies are actually dental problems that need immediate treatment. And it can start from bleeding, uncontrollable bleeding from the oral tissues, from the teeth, from the gums. You can have severe pain, is also a dental emergency. And then when you have a knocked out tooth, if a child is playing and then the tooth falls off, it's also a dental emergency. Severe infections in the mouth. I see a lot of parents post pictures of abscesses, gum boils. Today we are going to trash it, what you need to do when you see such. So dental emergencies can occur at any time. Children, the brain, it can result as a result of accidents, fall during play. And so today we will be focusing a lot on trauma. And I will start with when a tooth gets knocked out. When a tooth is removed completely from its socket, we call it avulsion in dentistry. And also when a tooth is chipped off or cracked, or when you have an abscess or swelling. Common dental emergencies are falls, spots when children are playing, fights. Show us a picture of where you can have different causes of dental emergencies. So I'll go straight to the knocked out tooth. Do you believe that when a tooth is knocked out, that is not the end? Most patients that we have seen come to the clinic without the tooth and they say, oh, my child's tooth fell off. Today, you should know that when a tooth falls off, it can be placed back. The permanent tooth, not the baby tooth, but the permanent tooth, when it falls out, we can put it back. So I will tell you the emergencies, the ABC of in such a situation. The first thing is not to panic. If you found out that a child has had an accident and it has involved you, what you need to do is calm down. Check the mouth and see if you can find the tooth anywhere on the floor, wherever you can find it. Pick it up gently. Do you know where to pick it? You should hold it by the crown. Dr. Gbemi, can you show us the picture of someone holding the tooth by the crown?
That's number
You
one.
hold it by the crown. That is number one. The crown is the part that you can see in the mouth, and the root of the tooth is the one you cannot see. It is buried in the bone. So you hold the tooth by the crown, and when you hold it by the crown, you rinse it gently under a running tap water. The reason why you should not hold it in the root is because the root contains fibers, and once those fibers are destroyed, they will not be able to attach back to the socket. So we do not want you to hold the root, because the root is what we will that root to be reattached back. So after that tap water, if you can place it back in the child's mouth, we'll prefer that. But if the child is in pain and will not cooperate, what do? You a cup of milk, not powdered milk, evaporated milk, if you can find, and put it inside the evaporated meat to preserve the tooth. If you cannot find milk, maybe it happened in the school, you take the child to the school sick bay, they should have normal saline. Put the tooth in the normal saline. Any of the above, just put the tooth in a cup of water. Why do we say this? The tooth is a living part of the body. It contains blood vessels, it contains nerves, and so we want to preserve the blood vessels and the nerves as much as possible. So when you put the tooth in a cup of water or milk or normal saline, it helps to save time. So when you have done that, rush the child immediately to the dental clinic. Once you take the child to the dental clinic, the dentist will put the tooth back and splint it for a period of 1 to 2 weeks, and that child will be fine. Instead of a child going about without the tooth and the child having poor self-esteem, or the child is not able to speak, or the child begins to wear artificial teeth, it's better you replant it. So Dr. Gbemi, if you can go straight to the picture, we have a picture of a child who had a tooth that was avulsed.
Yeah.
Yes, look at that picture. It can be a little bit, it's not scary. It's what happened to this child. This child's teeth fell off. 3 of the teeth were out of the mouth. But the good thing was that the guardian brought the teeth to the dental clinic. And look at the next picture. The teeth were placed back into the sockets and they were splintered. Look at that, 2 to 3 weeks. The next picture you would love.
Wow, this
shows
is so lovely.
Before and after. You see what happened? The parents did not know that they can pick the teeth and bring it to the dentist. That child will just have the teeth lost for life. So I hope we have all learned what to do when you find a child in that situation where the tooth is lost. What you should do, I repeat again, is to not panic. Look for the teeth or tooth. Hold it by the crown. Place it on that running water. Do not hold it by the root because we don't want to destroy the fibers that we attach it back to the socket. If you can place it back after it's into the socket, fine. But if the child is uncooperative, you place it in a cup of milk or a cup of water, a cup of normal saline, and rush the child straight to the dental clinic. The next thing we are going to talk about is also cracked tooth. Sometimes the tooth is not completely knocked out. It's just that the tooth is broken. This is also an emergency. I see a lot of people leave it because there's no pain. If you leave it like this, you are exposing the tooth to bacteria and all sorts of assaults in the mouth. So it's better you come immediately to the dental clinic so that what to do in this situation is if you can find the remaining fragments, bring it. We can reattach it as well. If you cannot, come to the dental clinic immediately so that that broken part can be covered or treated so that it will not result in pain in the future or abscess. Because it looks innocent. A lot of people carry broken tooth around. It will not show any problem now, but in future, can cause pain and it can cause dental abscess. And dental abscess, I can tell, can kill. As innocent as it looks, it can cause septicemia, which can go into the brain. So the infection can go from the tooth right to the brain. We have people that have died from dental abscess. They say, oh, it's so simple. It's an emergency that needs to be taken care of. Do not carry broken tooth around. Visit the dental clinic so that it can be taken care of. What about abscess? Dr. Gbemi, can you show us the abscess, dental abscess?
Yes, showing.
This is also threatening. I see a lot of these pictures. Mothers, please, are you listening?
Yes, ATP mothers,
Yes,
listen now.
ATP mothers, please. I see this picture so many times. I say, what do I do? This
Yes.
is an emergency. Be it
Okay.
a baby tooth or a permanent tooth. Bring that child immediately to the dental clinic. Why? Because this, what we are seeing here is an infection. The pain presently, but what are the things that can happen? This baby tooth I see here, the infection can affect the permanent tooth. And when the permanent tooth starts to come out, it's discolored or malformed. And so many people do not understand why one single tooth in the mouth is colored or malformed, because the baby tooth had injury or was abscessed and nothing was done, and it went ahead to affect the permanent tooth board while it was growing. So another thing that can happen is that infection, like I said, can cause a lot of problem. It can even go to the brain if there's an abscess. So this is an emergency. Do not wait to say, what do I do? It may need that the tooth should be extracted if it's a baby tooth. And if it's a permanent one, it may need what we call root canal therapy, where the infection will be removed and the tooth will remain there. So these are some of the dental emergencies that we need to know. How can we prevent this, especially for trauma? Mothers, fathers, caregivers, adequate supervision by competent adults during play. When in school, the adults to be there, play-friendly environments. I hope we have teachers, principals here.
Yes,
when in
our
school,
teachers,
you need to have environment where the children can play. Even if they fall, it will reduce or minimize the effects of their the fall. So I know that we have some things about padded areas where people can play, where the children can be comfortable. Also at home, we have a lot of tiles these days. The kind of injuries that we were never seen before, we are beginning to see them now, especially to the teeth. Because of tiles, fogs or carpets. But now things are changing. When you see a lot of injuries of the teeth, which are usually not there before. We're beginning to see that a lot. So mothers, please, even at home, make sure that where the children are, they are being supervised. And the tiles, maybe you have rugs where the children can be. You just have to pay attention to them. Also, you need to keep chairs and stools away from windows and balconies. Very important. When the children are playing or they have sports, let them wear mouth guards or helmets at the playgrounds.
Mouth guard, Dr. Bouquet?
Okay, mouth guard. The sports. Okay, can you show us the next slide? Under prevention, you show us mouth guard. Yes, those are mouth guards. If you can put your pointer at the mouth guard. Usually spots, you know, yes, it's put in the mouth to protect the teeth. You know,
where can we buy it in Nigeria?
And all that during sport. Oh, it's available. I'm sure if you go to sports what do you call it now? Sports shops. Yes, and we also make mouth guards in the dental clinic.
But I've not really been seeing children wearing mouth guards in Nigeria.
They should, especially for sports. They should.
Just for sports.
Yes, and not just for sports. Some children that their teeth at night, that's another thing. Recommend the mouth guard for them so that they do not wear their teeth.
We do get a lot of questions about children biting their teeth or chewing their teeth on ATP.
Yes.
So those mothers, Dr. Baki is saying you can get mouth guards. This will be very helpful.
Yes, in the dental clinic. Those are specialized mouth guards. Those ones will be, custom made for the children.
For the children, all right.
Yes, another thing is that children, their teeth are proclined. That is, they are far forward than usual. Those teeth needs to be corrected. If the child falls down, that's the point of call, you know. So those ones are more predisposed to having their teeth fractured if they have any accident. So if you have your child having proclined teeth, you need to bring that child to the dentist to have the teeth corrected. So we need to use mouth guard, headgears, and those that have dental issues need to come to the clinic to rearrange their teeth. So dental emergencies are there. They are preventable. Things like abscess. How do you prevent abscess due to tooth decay? Is by brushing twice daily for a child, using the appropriate amount of toothpaste and the appropriate type of toothpaste, fluoride containing toothpaste. Regular visit to the dentist at least twice a year, not when there's pain or when the tooth is already almost broken down. You need to come, for regular check. So all these emergencies are preventable, like I said. Adequate supervision, regular visit to the dentist, and coming to the dental clinic such happens. So in conclusion, I would like to say that dental emergencies in children are common and may be very distressful for both parents and child. Not just the parent, it can distress the child as well. These emergencies are preventable. When they occur, first aid treatment should be carried out immediately, and the child should report at the dental clinic as soon as possible.
Wow.
So,
Thank you so
in a
much, Dr.
nutshell,
Buki. That's a beautiful presentation. I have learned a lot. I have learned so much. I never know that
thank
you can
you.
reattach broken chips of tooth. I never know. I thought
Oh,
that is gone forever, that
yes.
you're just going to give us a new one.
No,
Wow,
no,
that's
no, no, no.
interesting. I see a lot of children with
Yeah,
chips of tooth everywhere, and nobody bothers. I mean, they just take it as part of life. So thank you
yeah.
so much, Dr. Buki. Thank you for the beautiful presentation. And so this is the time for us to have your question. So please ask us questions on dental emergencies. Yesterday, we had so many questions yesterday about dental, and now I told them, look, bring your questions today because that's when we're going to have the doyen, the experts on dental issues. That's when she's going to come up. And I don't know whether our moderators, if you are listening to me, can you help us pull out the dental questions that we had yesterday so that those mothers, the Tobuki, can address them as well for us today. But if you are listening to us now, you want to ask questions about dental emergencies, this is the time for you to post your questions online. Don't wait until when we are offline to drop your questions. This is the best time for you to ask your questions, and we'll be very happy to take them. Yeah. So, Dr. Buki, when you talk about taking them to the dentist, do they have to be pediatric dentists or just even any dentist would do for children dental emergencies? What do you say to that?
Yes, and because it is an emergency, any
Yeah.
dentist available at that time who can manage it will be
Okay.
able to manage it until the person is now referred, if need be, to a pediatric dentist. But as an emergency, any dental clinic nearby, general hospital, private clinic, should just rush down there if the tooth is knocked out, it should be taken there immediately.
All right. Thank you.
Or if they cannot take it there on that day, maybe it happened in the evening or at night, they can just put it in the medium, which is the cup of milk or normal saline or water, till the
Mm.
next available time. Immediately the child should be clinic.
Okay, so we have a question
Okay.
from Oluyemisi Gabriel. And Oluyemisi Gabriel
Okay.
is saying, Doctor, please, what age should a child have the first dental visit?
Okay, Mrs. Oluye, Missy Gabriel, thank you for your question. And that is a very beautiful question, because here I have seen patients and their first dental visit was when they were 20 or 30 years old. And I know that there are mothers on ATP or parents that have never visited the dentist before. So, question is, the child should visit the dentist before the first year of age, or when the first tooth erupts, which is about 6 months of age. Why do we say that? At this time, the dentist is able to give you oral health education that will prevent your child from having dental issues or diseases. That is when we tell you the type of toothbrush, the type of toothpaste that you should use for your. We'll start introducing the child to cleaning. As soon as the first tooth erupts, that's when you should start cleaning your child's tooth. Not with cotton wool, but with soft toothbrush and fluoride containing toothpaste. Many mothers feel, oh, this tooth is just one tooth, there's no need to clean it. It needs to be cleaned, because if dental tooth decay is preventable, and it should start as soon as the first tooth erupts. So to your question again, first dental visit should be on or before the first birthday.
Okay,
That's
thank
the
you
answer
so
to
much. Yeah, we're still
that.
waiting for your questions on the dental emergencies. And Dr. Buki, some parents do hacks, like, they worry that children losing their teeth, if they take them to the dentist, that's all you do is to remove the teeth, and they are worried that maybe that's why they don't want to come to you. So what do you have to say to such parents?
That is a very beautiful question, Dr. Gbemi.
Yeah,
You
well,
see,
thank
what
you.
happens is that people come to the dentist very late,
Oh,
when
okay.
there's nothing the dentist can do but to take it out. That is why
Oh,
the first
okay.
question precedes this one. When the child has the habit, you have started training the child to visit the dentist, things that you cannot pick up at home, just bring the children during the holidays, whether they have toothache or not. We'll just look at it with our instruments, and if there's any early sign of tooth decay, we treat it immediately and the tooth goes to rest. But if a child is complaining, today my tooth is paining me, the mother says, don't worry, take this use this mouthwash or use this paracetamol. The child will
Mm,
have immediate relief, but after some time, the pain will come back, the infection continues until the
mhm.
tooth is totally destroyed. And when the child comes to the dental clinic, we have to take it out. So a lot of
Okay.
parents in Nigeria, I can say, come late to the dental
Okay.
clinic and
So basically,
nothing we can
what
do.
Dr. Buki is telling you mothers is that if you go to the dentist and they have to take out the teeth or the tooth, depending on how many, then that means that you were the one that went late. If you have gone on time, so maybe we should stop posting so many dental questions on ATP, because most of those ones you post that Dr. Buki is talking about, they're actually dental emergencies. So if you're just joining, I will want you after the broadcast to watch the video, because she has so many beautiful pictures and telling us what are dental emergencies, so that you can know. So once you see them, there is no point posting on ATP. Just look for your dentist. I mean, go to the dentist as soon as you can. And I was so impressed that they can still salvage some of those teeth, especially if you go early. But if you go late, of course, there's really nothing they can do. So kindly do not waste time. Make sure you go and see your dentist as soon as possible. So we're still taking questions. Dr. Buki is here now. Please, please, please send your questions now. Don't come and ask Dr. Gbemi. I don't know. So I won't be able to help you. Yeah, the person that can help you is here now. So kindly ask your questions, and I'm sure she will address them. So meanwhile, I'll keep on asking Dr.
Right.
Buki some of those common ones that I've seen on ATP, and I'm sure
Yeah.
she will be able to address them. And one of the things mothers do is that they struggle with the children when it comes to brushing the teeth and all that. So
Mm.
And one of the questions they were all asking, some were asking yesterday, one parent actually told us yesterday that she used alcohol to wash the child's teeth. I mean, that the mother-in-law used gin, I mean, ogogoro, that's strong alcohol, ethanol, to wash the mouth of the child. And somebody else, so Dr. Buki, what do you say to mothers that are doing? In fact, what happened after that was that the child slept off for 4 days and it was
Oh
an
my God.
so I see all sorts of things. Some people use glycerin, some people use salts,
Oh
some people
my.
use all sorts
Mm,
of things. And some people think that new
mm,
babies that when they
mm,
have teeth, then I mean that they are too young for you to use brush, they are too young for you to use what's it called, I mean toothpaste and toothbrush. So that's okay, what do you say to that basically?
Wow, that is amazing. A child's tooth was cleaned with gin. That
Yes, ma.
child will obviously sleep off because that child cannot. I don't know the age of this child. Most of the time, we don't even recommend mouthwashes for children less than 6 that cannot spit out the
Mm.
mouthwash because most of the time they will just swallow it and it has its own side effects. And that is why that child slept off after cleaning the mouth with ogogoro. The child, of course, will sleep off for days. Please, mothers in the house, please, 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 please. I don't know how dirty that child's teeth must have been to want gene. Please let us just stick to. Let me tell us now from when a child is born what to use. Once a child is born, a few days after, use clean cloth
Okay.
dampened with water to
Mm.
wipe the child's gums and tongue and mouth.
I hope you are listening,
That's
oh,
all.
mothers.
This is just to start inculcating the habits of good oral hygiene from when the child is born. Water and soak with clean cloth or any clean towel, if possible, to be thrown away after use. You clean the child's mouth with it. That is all. Anything that cannot clean, it may be an infection, it may be thrush or fungal infection. So you need to bring that child to the dental clinic. Please don't sleep in the I've seen parents trying to force white discoloration on the child's tongue by using blade. Please do not. Anything that you cannot clean with water and clean towel, please bring that child to the dental clinic. So this is when the child does not have teeth. It's just the gums. Use clean white cloth or clean towel dampened in water. As soon as the child starts to erupt or grow the first tooth,
Mm.
you all you need is a soft toothbrush. I'm sorry I do not have my illustration here because we were talking
We
about
were
dental
not, yes, so
emergencies.
yes, yes,
I
ma'am.
have a book, I have a handbook. If you want it, just let me know. You can send a private message to me that
Yeah.
gives a picture of all you need to know about a child from birth to when the child is adolescent.
Yes.
So when the first tooth erupts, what you need is soft toothbrush. We have baby brushes that they write 0 to 2. Or there are some brushes that you can wear in the finger. They are soft brush like rubber. They sell them at the baby shops. I don't know how many mothers have seen it. I'm sure some of you have seen it. Just put toothpaste you need is the amount of children 0 to 3 years. Amount of a grain of rice, not more than that. The reason is because toothpaste contains fluoride, and fluoride has its own
Okay.
side effects. You
Yeah,
don't
but
want the
Dr.
child to
Buki,
start
all these
swallowing.
your adverts on TV about toothbrushing, we see
Yes.
them putting this all thick, long, long.
And coily.
Dr. Buki,
Not
what is
just long, it's not coiled. It now calls again.
And call her.
That is advertisement. So that you finish on time.
Can Nigerian Dental Association do something about it? Because I think it confuses parents a lot. So that they actually get the advertiser to use the grain or the pea size picture.
You know why? The people advertising are advertising mainly for adults. I think we need to have children's toothpaste being
Oh,
advertised and putting
okay,
the right
okay.
amount.
So if you are
Yes, because
if you are makers of toothpaste, come and advertise on ATP for children. We will show you your toothpaste. Yeah.
children 3 to 6 years, you need a size of a pea size. The pea, that's the vegetable peas.
Most
Vegetable,
Nigerians
that
don't
green peas.
use the tabuki.
Okay, if they don't know green peas, we know the
Okay.
size of a granite, small
Oh,
granite size,
no
very
granite,
small
we know
granite size.
granite. Thank
Peas is that green vegetable that we buy, peas, green peas.
you. Okay, yeah,
That's
I
how
know.
round
Yeah,
and green
yeah,
it is. Green
yeah.
peas is small and round. If we don't
That
have
you use to
that, then
cook
you
your
can
fried
use
rice.
yes, a pea size. That size is just it for 3 to 6.
Okay.
Because of the amount of fluoride, that those children are growing up this time around, they can begin to, so you
Okay.
can use mouthwash or mouth rinse for children below 6 years. We do not recommend. A lot of mothers say, "Oh, I've been using mouthwash, mouth rinse." No, children
Okay.
we usually mouthwash for them.
Okay.
So
Thank you,
once the
sis.
child is above 6 years, you can now use the coily any amount of toothpaste, because that child is in control and can spit out fluoride.
Oh,
Yeah.
okay. Okay. All right. Okay. So, Dr. Buki, Mary from our watch party is asking, my 8-year-old is still losing her teeth. Is that normal?
Oh, that is very normal,
Mhm.
because the 8-year-old child is still in mixed dentition.
Okay.
So in fact, that is the perfect age for the mixed dentition stage, because you're having permanent teeth growing and baby teeth still falling off. In fact, you can have baby teeth still up to 10, 11 years. So it's not anything to worry about.
Okay, thank you, Dr. Buki. And our question is still coming in. Elizabeth is asking, my son of 2 years is always swallowing toothpaste while cleaning his tooth. How can I avoid it? And I guess she's asking, what damage does that swallowing of toothpaste, what does it cause to the child?
Yes. That is why we talked about the amount, because fluoride, you can have fluoride toxicity. Fluoride toxicity, a child licking like 5, or 10 close-up toothpaste.
You know,
You
Dr.
take
Buki,
it
some
and
children actually go to the bedroom if you leave your toothpaste and they actually lick it. One of my son used to do that. He would go and just be licking it. I hope he's fine. I don't know. So what do you say? What do I do?
yeah. Let me finish with Elizabeth Daniel's question. So the
Yeah.
best way, you do not worry. You need the right type of toothpaste. I see a lot of mothers using Sensodyne because the advertisement is. Sorry to mention the name. I tried not to mention
Mention
any
brand name.
toothpaste here.
Yeah.
Yes, I know. Yes, there's some toothpaste that are not meant for children. So there are some specified toothpaste that you can go to the market and buy. It contains fluoride. That it is so small that even if a child swallows it, you should not have any issue. And if you stick to the right amount, because for this you have been listening to me, size is what you should use, child. So if you use that and the child leaks difficult, you should not have any problem, because there's a certain paste, fluoride, which is the active ingredient that can cause issues. fluoride that if a child takes it, it can cause toxicity. So you are fine, provided you use the amount of toothpaste we have said. And then for Dr. Gbemi, you know, children always like to go and, you know, take the toothpaste and lick it and all that. So we still need to supervise them. We have to make sure that it is not within reach. When they need it is when
that's what we
and
try to do. Try
let
to
them
hide
know
it.
that yes, did you know, when
Okay.
they grow up. We all did it as children.
Okay, Dr. Buki,
Okay.
Onyi is asking, well done, Ma, for the wonderful presentation. In a case where
Thank
the
you.
broken tooth parts wasn't found for possible replacement, what then happens?
Yeah. Okay. So if the broken tooth, not the avulsed tooth, because there were two things we talked about. We
Yeah.
talked about if a knocked out tooth, a tooth is completely knocked out of the socket, that is, it comes out whole.
Mm.
If you well, still bring the child clinic, depending on the age of that child. If it's the permanent tooth, we can put artificial teeth for the child. Now that one goes in the artificial tooth. And then if the broken parts, if it is now that the tooth just got broken, Dr. Bemi, can you show us the picture of broken? Because there were two, a completely knocked out tooth, and if the tooth is broken. So if the tooth is chipped up, if you cannot find the remaining parts, we will use a tooth colored material to fill it up, and it will look like the way it was before. We put a
Okay.
crown to cap the tooth, and you will not know, it will just come out fine. So look at, for
Okay.
instance, this tooth was broken, and look at it after the repair. So you can never tell that the tooth
Okay.
once you
Thank you,
come
Dr. Buki.
to dental clinic.
Yeah. Oluyemisi Gabriel is still asking that, doctor, is fluoride toothpaste good for children of all ages?
Yes. An association of pediatric dentistry, and even our association, Nigerian Association of Pediatric Dentists, we recommend that you should use fluoride children, fluoride containing toothpaste. But
Okay.
you must buy the appropriate type of toothpaste for a child that does not contain too much fluoride.
How
If
do
you go
you
to
know
the
what is
market, you will see
appropriate?
some. Yes. Well, because I do not want to mention names, I don't know if we are permitted to do that. We have a lot of toothpaste that is available in the market that are mainly for children.
Okay. Is there
They are
something
in
they
the
can see
market for
on the
children.
that is there something written on it that will make the mother know that that is appropriate for a child or for children?
Yes, well, the amount of fluoride will be there.
Can you tell us the
That is
amount?
not as much as the adult toothpaste, depending on the type of fluoride that is being used.
Oh, okay.
So I may not want to go, yes, the type of, because we have different stainless fluoride, sodium fluoride, you know, different companies use different formulations. So
Oh,
it's
okay. So,
so I
Dr.
would
Buki,
rather
do you
say
just
that
say
if the person can send me a private message, then I can say, okay, the
this
kind of
one and that
toothpaste that
one?
can be used. Yeah, I don't know, but
Dr. Buki, why just tell us a few of them so that the mothers don't get confused. Don't worry, we'll give them the free
okay.
advert.
So we have milk teeth. We have milk teeth in the market.
Okay.
Milk teeth. It is very available. If you go to any supermarket, even in the market, you will find milk teeth. It's for children. I can tell you that you can use that for your child. So if your child
Okay.
is 2 years old, use a grain of size of milk teeth toothpaste and you'll be fine.
Okay.
Just a grain of rice, size of a grain of rice amount of toothpaste, and that will be
All right.
fine.
Thank you, Dr. Buki. But I see a lot of toothpaste that they will say this is for not mixed. It is not the name. It's any of the other popular brand. They will now say the
There are some
mixed
other
teeth
ones, yes.
version.
We
Is
have
that
some
also
Go
fine?
Colgate Junior.
Okay,
We
go
have
Junior.
Colgate Junior. Colgate Junior is there. You know, those ones I can tell you that they're okay.
Okay,
And then
okay.
the milk tea.
Thank you. If you want to know more, just send us a message. Dr. Buki will answer that. But tell the makers to come and advertise on ATP. Thank you.
They should. Free
Okay,
advert.
Dr. Buki, Toyin is asking, how can we correct brown teeth as a result of neglect. In other words, these are one of those ones you were mentioning that maybe they didn't come to the hospital on time. Now the teeth is permanently discolored, brownish. Is there anything they can do about it?
This is a very large topic when we talk about tooth discoloration.
Yeah,
There are
maybe we'll
many
bring you
things that
back
can
for another
cause
talk.
tooth discoloration arise from even when the mother is pregnant, when the child is not born yet, what the mother takes in, like
Yeah.
some kind of drugs like tetracycline medication, which we
Yes.
have
Yeah, we've
saying
always
that
said
mothers
them
should
not to do
not
that.
take it because it discolors it will discolor the child's teeth. And even when the child up to 8 years old, avoid using tetracycline medication. It can discolor those teeth that are forming at that time. So those ones are intrinsic stain. No matter what you wash, it will not wash off because is embedded in the tooth tissue. It occurred when the tooth was developing. So it developed together with the tooth. You cannot use any toothbrush or toothpaste to remove such stains. There are some other stains, those ones we call extrinsic stains. That is, they are outside. They are not inside the tooth. They are outside the tooth. Those ones can be easily removed when you come to the dental clinic. And what are the causes of this? You have things, foods that stain the teeth. Even some medications stain the teeth. You have coffee, things like coffee, some beverages, some iron syrups, some medication. Even not brushing the teeth well can make the teeth change color. The teeth now become stained with plaque. And it forms like a rock. It is untitled to, you know, this of stain that is in your child's mouth, the appropriate treatment for it. Come to
Okay.
your dentist.
Okay, so Dr. Buki, we seem to be losing you. Can you refresh?
Okay. Let me refresh now.
Okay, thank you. All right, Dr. Buki is still here, but I seem to be losing her, so we're just trying to make sure we can hear her pretty well. So we still have questions coming in. So Adeshewa, basically what we're saying is that you need to go see your dentist and they will take care of the brownish tooth. Let's go on. Okay, the Sabuki is back. And Obakpa Akosua is asking, my child is 1 year and 1.5. Can I start brushing the teeth? Sister Buki, are you with us? Okay, it's like we have lost Dr. Buki, let us say. So, I think Dr. Buki has answered when you should start. You should start immediately, even right from the time baby is born. Okay, Dr. Buki is back. Let her come and answer our question. Okay, Dr. Buki, you're better.
Yeah. Okay.
Yeah, please just make sure your mic is closer to your mouth. We seem to be losing your voice. Better, thank you. So Obakpa Haposwa is asking that my child is 1.5. Can I start brushing his teeth?
Oh yes. By 1.5, I expect that your child should have more than 4 teeth in the mouth. So you should have started brushing by the time he brought out his first tooth. So you should start. If you go back to the video, we have talked about the age of brushing. It should be as soon as the first tooth erupts. Use an appropriate toothpaste for children, formulated for children. And at that age, all you need is the size of a grain of rice amount of toothpaste with brush, not cotton wool, toothbrush. We have brushes 0 to 3 to 2 years. And we have those soft brushes that are sold in the market, finger brushes. You can also use that. That's one we also help to massage the child's gums because at that time the child is still teething. So it can brush the teeth as well as massage the child's gums.
Okay, thank you, Dr. Buki. We are rounding up very soon. Amsat is asking, my baby girl of 1 year, I noticed yellowish brown stain, first upper tooth, also some wear and tear, as if a part of teeth breaks. The teeth has rough edges. What do I do, please? Thanks.
This child is okay. Amzat
Seems like we're losing Dr. Buki again. Okay, I think we lost Dr. Buki, but she'll be back. Amzaz Rakibat, just give us a few more minutes. Okay, Dr. Buki is back. Dr. Buki, you're back.
yes.
Did you get
So
the question
that
by Amzaz?
yes, I got the question. That child has some form of teeth malformation from your
Okay.
description.
Oh,
And
okay.
it must have happened while the teeth were forming. It could have been while the mother was, pregnant as well. So this kind of stain and this teeth at this age should not be breaking or chipping off. So there's some form of structural defects that the child is having, and it can be attended to. If you bring the child to the clinic, we can treat the child and then further investigate what could be causing it. It's not just sometimes some of the issues that we're having, systemic issues, medical issues, they can start showing from the mouth, because the mouth is the gateway to the body. Sometimes some serious illnesses we detect it just from the mouth. You can tell that some diseases that are going on in the body. So if you can bring the child, we'll look at your child, look at the teeth, take care of those rough teeth and the stains, and also further investigate to let you know what you can do. That child needs an emergency care before we fortify those teeth to
Okay.
continuous
So please,
care.
Amsat, go and see Dr. Buki at the dental clinic. Uh, Ojo Olajumoke is asking what is the best toothpaste. We've answered that already. I believe you've had it already. Yemi Faju Igbe is asking, why is dental care so expensive? Dr. Buki, is dental care expensive?
Expensive is relative, because as you say it's expensive. Some people feel that it's just out of pocket they can pay. uh, Dental care is preventable, it's and if we can go towards the line of better than cure, is always very good. So that's the should come up with this too. We also need to take care of them. The
Okay, so
private clinic and it's too expensive. You can go to the general hospital. The government hospitals,
are
they are
not as
more
expensive.
affordable than the private. The
Okay, okay. Uh,
uh,
Ebuwa Ozasuyi is asking, my son of 12 is still losing his teeth. Why? Is that an abnormal thing, Dr. Buki?
what teeth? Are they the baby teeth? If they are the baby teeth, it's fine, because this stage two it's possible that the child is still bringing out some baby teeth. So if they are the baby teeth, not the permanent teeth, if they are the permanent, but if a child is losing the baby teeth, then it's giving way for the permanent teeth to erupt.
Okay, so if you are not sure, just go and see the dentist so that they will know which teeth your
Yes,
baby is losing. Yeah.
which yes, very
Okay.
important.
Yeah. And then Ojo Damlola is asking, finger brush versus toothbrush for a newly erupted teeth. What do you advise, Dr. Buki? You know what the mothers use as
That's for
finger brush?
yes, I know it's the soft like rubber-like toothbrush. It's
Okay.
fine. It's a form of toothbrush as well. You can use it because it has some bristles, to take care of the plaque. Because
Okay.
cotton wool will not remove the plaque. They can be
Oh,
very tenacious on the teeth. So you need
okay.
something that will brush it off. So
Okay.
anyone you find available, you can use. But as the child is growing and having more teeth, you will need to use toothbrush.
Okay.
Otherwise, the child will start biting you with the finger brush. You can use finger brush when a child is still innocent and still, but by the time the teeth are many, you know that nobody will tell you that you don't need to use the finger brush anymore. All right.
Okay. Now, this question by Falashade is one of those recurrent questions we get on HCP. A child who has lost their
Mhm.
tooth or teeth, and maybe after 9 months and 1 year, the thing has not come back. It makes mothers panic a lot. And Dr. Buki, what do you have to say? Should they be worried or what? Because we get that question a lot when the permanent tooth is not coming up as I don't know what's the gap. When should they expect them back? I mean, up because mothers ask that a lot. It's like I lost Dr. Buki there. Okay, just give us a few minutes. Dr. Buki will be back because I really want her to address these particular questions and all that. Yeah. Dr. Buki, are you with us? Okay.
Yeah. Okay. Are we back?
Yes, you are back.
Are we
Please.
back? Okay,
Yes, please.
great. So, yes, like I was saying about mothers worrying, we have different ages of eruption of. As you see, the teeth they are different, and they have different times that they erupt or grow, like the mothers will
Mhm.
say. So we have it depending on the tooth that you're expecting. For instance, the mothers are usually worried about the upper permanent teeth. We expect them to come in around 7 to 8 years. So
Okay.
if by 8 years old, the first upper tooth that should come out, the middle one, if it doesn't come out by 8, then but by 7 years old, oh no, I'm not worried at all. Because I know the time of eruption of each tooth.
Mm.
So I don't think you should worry. Because some
Uh,
children are fast, and children are different. Apart from that, the fact that the teeth have different times of eruption, children are also different. Some children are fast, some are just taking their time. So
Okay,
that's it.
so but Dr. Buki, is there a timeline? Like if a child lost a milk tooth, is there like a
Yeah.
minimum amount of time that the teeth should be? I mean, that tooth should
Okay.
come, the new one should come back, or it doesn't matter as long as
Okay.
that age of that child is still within the normal age you will be expect. I mean, you understand the point?
Between 6 months to 1 year,
Okay,
you
6 months
should
to 1 year.
have the tooth come out. But if the tooth got lost as a result of trauma too early, let's say the tooth was supposed to fall off by 7 years and the tooth fell off by 3 or 4 years, that can
Mm.
also cause delayed eruption
Oh,
because
okay.
the gum will have now become so thick and fibrosed,
Oh,
and it
okay.
may prevent the permanent tooth from
From
coming
coming
out.
out. Okay,
So
we
that
get that as
so if
well as well.
there's, yes, there's problem if the child loses the tooth too early. Like a child loses
Okay.
the baby tooth by 3 years or 4 years,
Mm,
around 3 years. So that one you need to monitor so that when it is now time for that tooth to come out,
mm.
you'll be monitoring it. Yes.
Okay.
So
All
too
right.
early too is a problem. Yeah.
So in that case, they should just come and meet the dentist.
Yes. If they are not sure, just come. We will take X-ray.
Yeah.
We will show you the picture of the permanent tooth that is there if it is there. Sometimes the permanent tooth is not there. It's rare, but
Wow.
it happens. So
Oh,
if you are not
okay.
sure, you have waited some time, just come. We take a radiograph for you. We show you the picture of the permanent tooth where it is, and so that you will not worry. So the best thing to do when you're not sure about things, just find time to come to the dentist, and then we can show you that. No worry, this tooth is in position to erupt.
Okay. All right. Thank you, Dr. Bouquet. I have a question by Dalby. Dalby is asking that what happens if the half broken tooth that has been fixed with crown is cracked again? What should be done? Dalby,
Yeah,
why is
that.
the child cracking the teeth several times in the first place? I hope it's not a case of we pediatrician need to come and look at what you are doing in your house.
Where it may not be their Dalby's fault. It's just that sometimes the children, it could be as a result of the child,
Mm,
maybe continuous falling, or maybe
yes.
there are so many factors that can cause it. But if it happens that way, because it's not permanent, because
Mm,
what we usually use is like a white, what we call it composites. It's like a white
okay.
cement that we use to hold it, shaping,
Mm,
build the tooth back into shape.
okay.
Just like you're
Yeah.
building a house with cement and shaping
Okay.
it, we
Mm,
use something like that to build
mm,
that tooth back.
mm.
It can now have a
So
more permanent, it's called porcelain. They can have that. That one can stay because it's more durable, but you cannot use it for children. So as the child grows, you can now have a permanent
okay,
crown.
okay. Oh, Dr. Buki, are you saying that is it because the substance you also use for repair is also a little bit fragile and it can still break, or what? Is it also from your dental angle?
You shouldn't break. It's not as strong because these different materials we use
Okay.
depends also on the. For instance, if you want to give an implant, I cannot give you an implant to a younger child. Falls
Okay.
off complete. Some certain type of crown that we can
Mm,
give adults because
okay.
those teeth they are still erupting. It's what we call passive eruption.
Okay.
Or stronger, depending even on the cost. Sometimes some of these things that we
That's what
use,
somebody say. Why is dental care so expensive?
they're more expensive. Expensive all over Nigeria is even still
Okay. Thank you, Dr. Buki. Dr. Buki, we seem to be losing your.
okay. If
Okay,
I
I think you're back. You're back. Your audio seems to be
can
going
say,
off. Okay. Okay, final question for Dr. Buki because of our time. Akwe Asho Ihedioha is asking, say, well done, Dr. Buki. I am worried about my 3-year-old
kill.
because of his breath. He said, we try to clean up at morning and at night with age-appropriate space, and I change his brush often as well. I want to know if he can
Very good.
floss and if he can use mouthwash at his age.
Okay, the first thing is that she's worried about the breath. Do you think the child's mouth at 3 is not it's smelling? There are many things that can cause bad breath.
Yeah.
If a child is having infection in the throat, in the nose, it can reflect in the mouth.
Okay.
So many things can cause that. But if child is not having any of those infections or some underlying disease, then you should just clean the child's teeth and it will be okay. Sometimes our parents are overbearing. I've seen parents that will say my child's mouth is smelly, smelly. The child will come, we will remove face mask, try, we will not smell anything.
Maybe the parents knows that it's smelly.
But
Apologies.
for this 3-year-old child, please, 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 if you are not so sure, just take the child to the dental clinic. But if you use the right toothpaste, brush twice daily like you're doing, the child should be fine. I think she also said something. One more thing. I
She
don't know
said,
if I
can the child
answered that.
floss? Can she use floss? Can she use
Oh
mouthwash?
yes, you can use floss. Yeah, not mouthwash, please. I
Okay.
said it that
Six
children below
years.
6 years cannot use
Yeah.
mouthwash.
Okay.
Mouthwash,
Okay.
some
I
of the
hope you can
mouthwash
hear.
contain alcohol. Yes, some of them
Mm-hmm.
contain alcohol, some strong. Yes, so we do not want the children below 6, because they cannot spit out. They will drink it and you don't know what can happen to them. Sometimes when you say, oh, you rinse your mouth, you notice that sometimes you just say, oh, child will just open the mouth and there's nothing there anymore. The child will just spit out. So please do not use mouthwash for children below 6 years of age.
Okay, so Adele be saying thank you so much, Dr. Buki, for the explanation. I think she really loves it. Thank you so much. And on that note, Dr. Buki, so what is your final word for us?
Yes, final word for everyone. It's been nice to be here. Thank you for having me here. Happy anniversary to you all, mothers. And I'm sure that you have been enjoying this program. I wish to congratulate Dr. Gwemi once again on putting this together. That's out there. Well done to you. So finally, dental emergencies are preventable. Do make sure that you appropriate supervision during play. If you are not sure of anything, please run to the dentist immediately. Bleeding gums, pain, gum boils, infection, they are serious emergencies that you need to bring the child to the dental clinic. And if a tooth falls off completely, look for the tooth, hold it by the crown, rinse it under running water, put it in a cup of milk or a cup of normal saline, bring it immediately to the dentist, we'll put it back and the child will be fine. Thank you. I wish you all a blessed anniversary. See you next year by the grace of God for another ATP anniversary. Happy anniversary to you all.
Thank you so much, Dr. Buki. I am so delighted that we have you here. I have learned so much myself, and I really want to say thank you for taking so much out of your time. I know it's not a very convenient thing for you, knowing that you're actually in transit over many cities and river, but I'm so grateful that you were able to find time out of your busy schedule to join us. And I think I personally have learned so much. I mean, for myself, I've learned quite a lot from this presentation. It's a very beautiful one. And I'm hoping the mothers on ATP have learned as well. So don't post all those dental abscesses anymore. Go and see your dentist. There's nothing we can do about it. So Dr. Buki, thank you so much for joining us tonight. And we wish you a wonderful evening. Thank you so much. So if you still have questions for Dr. Buki, just post it on the group wall and we will see how to tag Dr. Buki to answer them. Thank you so much.
Yes.
Okay.
All right. Thank you. Bye, everybody.
Yeah. Okay. So we're going now to the next presentation, and this is our last presentation for today. And one of the things parents tend to ask us is about CPR, and the last time I mentioned about how to do CPR, some of the parents were not so sure what I was talking about. And so today I have in the studio with me Dr. OGUNLEWE, who is the Senior Registrar, Department of Pediatrics, University Teaching Hospital. And Dr. OGUNLEWE is going to be telling you how you as a parent can do CPR. The worst thing that can happen to a parents is if their child collapsed on them, and sometimes emergency rescue may take a while to come. And so today you're going to have, it's more of a practical demonstration of what by Dr. OGUNLEWE, telling us what you can start doing. And I can tell you that doing this CPR saves lives. In fact, it can make the difference between life and death. So if you are watching, I want you to share this video. I want you to invite your friends. Let them come and join us now, because I am telling you, you're going to learn quite a lot from this video. So Dr. OGUNLEWE, you're welcome.
Thank you very much.
Yeah, please. Okay. You're welcome. So over to you.
Oh, okay. Okay. Good evening, everyone. Good evening, viewers. I hope you all had a lovely day today.
Yes.
In the next few minutes, we're going to be discussing CPR, which means cardiopulmonary resuscitation. I'll try to use a language that everybody can understand. I'll be as simple as possible. And at the end of this discussion, I expect that we should all know what CPR is all about. We should be able to recognize a child that requires CPR, and we should be able to perform effective CPR. And many of us might be wondering, why do I need to know about CPR when I'm not even a medical personnel? The truth is that every individual should be able to perform CPR because it may mean the difference between life and death when it comes to saving the life of a child. So what is CPR all about, really? The only reason why I can probably speak to you this evening, or the reason why you can actually listen to me, is because both our hearts and lungs are functioning effectively. So if you hear the word cardio, it means heart. And when you hear pulmonary, it means lungs, and resuscitation, to bring alive. So the heart and the lungs, they work together so that we can function properly. Now what the heart does is this: it helps to pump blood around the whole of the body so that blood can get to all our organs, the brain, the kidneys, the adrenals, to every part of the body. And what does the lung do? It helps to provide oxygen for the body. So the heart pumps blood around, carry oxygen to every other part of the body. So they work together to make sure that both of us can actually function effectively day to day. To know about cardiopulmonary resuscitation, it means that if for any reason the heart stops working or we stop breathing, oxygen and blood cannot get to the organs in the body, and this may actually result in death. And I'm sure that when we see that a child is unresponsive or not breathing, we do not want to panic, we do not want to be helpless. We need to start something immediately to make sure that oxygen and blood can get to every organ of the body. So cardiopulmonary resuscitation, which I'll be referring to as CPR henceforth, means that it's a way of, it's an emergency. That's the first thing we need to know. It is an emergency. So we are temporarily doing the work of the heart and the lungs, helping the heart to pump blood and also helping the body to receive oxygen while we wait for help to arrive. So in what are the common situations in which a child might require CPR? Sometimes just accidents like drowning, choking, sometimes electric shock. Sometimes the child is so ill, the child becomes unconscious. So how do we recognize a child that requires CPR? There are four. First, is the child responsive? And secondly, is the child breathing normally? So how do we recognize that a child is responsive? One of the things we need to do is to tap the child and talk to the child. Are you all right? Are you okay? What we actually expect is that the child should either open the eyes or actually respond to us by answering. If the child does not do this, then that child is probably unresponsive. The second thing we need to do is this child breathing normally. It's not enough that the child is breathing. The child must be breathing normally, because sometimes the child might be gasping and we think the child is breathing, but the child is not breathing normally. So in assessing breathing, look out for, you look, listen, and feel. So what does looking entail? Look at the chest of the child. Is it moving up and down in a regular pattern? Number two, listen. Just bring your ears close to the nose of the child. Can you hear any sounds that show that the child is breathing? Then thirdly, feel. With every breath, you expect that you should be able to feel air on your cheeks as you try to listen to the child. So we can actually try to demonstrate it now. Let's put our hands in front of us. Let's breathe in and out and see if we can feel air movements on our palm. It's the same thing that you should get when you're assessing breathing for a child. So if a child is not breathing or is unwritten, that child requires CPR. But if a child is unresponsive and is breathing, please do not do CPR for that child. So the child must be unresponsive and not breathing. Now, CPR, you commence immediately. If you are alone, do at least 2 minutes of CPR before you call for help. But if you have two people with you, one person can quickly call for help while the other person starts CPR immediately. So how do we perform an effective CPR? First, are you sure that the child is not in danger, is actually safe? Once you've ascertained that, the next thing you need to do is lift up the chin of the child. Open up the airway by lifting the chin of the child. Secondly, give rescue breaths, 5 rescue breaths, which involves breathing through the mouth of the child, and ensuring that the chest is rising. At the end of this discussion, I'm going to actually do a demonstration to tell you so that you can actually see what I'm talking about. The next thing you want to do is to start your chest compressions. Now, the thing about chest compressions is this. The rate and depth of is very, very important because you want to be effective in pumping blood around the body. So first, just locate the nipple line of the child, just at the center of the chest. That is where you're going to place your fingers. Now, you must compress at least 1/3 to half the depth of the diameter of the child. And you do 30 chest compressions to 2 breaths. So you're going to go 1, 2, 3, 4, 5, 6, until you get to 30 before you breathe for the child. You're going to continue this until help arrives or until you get to the hospital. So let me quickly demonstrate what CPR is all about. So we're going to be using this mannequin. So you get to a scene where you've ascertained that a child is unresponsive and not breathing. So how do you check that the child is unresponsive? You simply tap the child. Are you okay? Are you all right? Open your eyes. What you expect is for the child to open his or her eyes, move the limbs, or answer you. So like I said earlier, if the child doesn't do any of this, the child is unresponsive. Check for breathing. Is it rising up and down in a regular pattern? If that requires CPR. Remember, you have only 10 seconds to decide if a child is unresponsive or not breathing. Because the earlier you start the CPR, then the greater the chances of a good outcome. So simply lift the chin of the child. You don't want to extend too much, and you don't want the chin of the child to be bent this way. So just simply lift the head of the child so that you can open up the airway of that child. The next thing you want to do is to quickly give 5 rescue breaths before you start your chest compression. Now, if the child is less than 1 year of age, what you need to do is to cover your mouth to cover the nose and the mouth child. So what you want to do is, and you blow. If it's effect child to rise, I'm sorry, this mannequin isn't going to do that 5 times. There are rescue breaths before you start your chest compression. So for a child that is 1 year, you're going to use 2 fingers for your chest compression. This is the center of the chest. Locate the nipple line. So just below the nipple line. Be careful not to touch the ribs. So you're going to do your compressions in this manner. Your hands must be straight. You don't want your elbows to be bent. And so very fast. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 30. And you quickly give your rescue breath. And then you continue the cycle. The child is actually an older child. Your palm to do the chest compression is this, the same location, just below the nipple line. And at a rate of, you want to be able to do 100 chest compressions in a minute. So that's about 2 compressions in a second. So the same thing, the depths, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, up to 30. And then you give rescue breaths. You're going to continue this until help arrives or until you get to the hospital, or sometimes until the child becomes, if the child becomes responsive, what you expect is for the child to either talk, open his or her eyes, or you notice that the child is breathing regularly. Now, once the child becomes responsive, the next thing you need to do is to place that child in recovery, to the hospital immediately. So just do this. This is the recovery position, and turn the child on his or her side. Then you go to the nearest hospital. So the most important thing here is time is actually a factor. So you need to start CPR immediately, as soon as possible, because of a good outcome. And even some outcome already occurred. Such a child will not be or her normal life. Points about CPR that I want you to remember. 1, every medical personnel should be able to perform CPR. CPR agency is a way of pump oxygen-rich blood to every part of the body. the rate and depth of your compressions are actually very important, because if it's not done properly, then it's as good as doing nothing. And I'm sure we as parents, when we find ourselves in that situation, and many of us are saying that's probably not my portion, my answer is amen. But when you're in that situation, you don't want to panic or feel helpless while you wait for help to arrive or while you wait to get to the hospital. I hope in the last few minutes you've learned a little bit about CPR, and when you see a child or even a stranger that requires CPR, we'll be able to perform one effectively. Thank you.
Yeah, thank you so much, Dr. Ogunlewe. I've learned a lot myself, and I want our parents to ask questions now. So Dr. Ogunlewe has demonstrated CPR, and I know, like she rightly said, many of you are going to think it's not going to be my portion, but so what normally happens, what I see is that when babies have emergencies in Nigeria, what most people do, most Nigerians do is to egg bamio, then you start running, Jana, you run up schedule, carrying the baby up and down. That is not the solution. Thank God now for those of us in Lagos State, you have the ambulance services that you can call, and the number is 767 and I think 126, which you can call and say, I have a baby who has collapsed, and it really works. So don't assume it doesn't work. It works. But like she said, sometimes there's even no time to get the ambulance service. So you may be the one to start the resuscitation. And sometimes that may be the only thing that can that maybe make a difference between life and death for the children. So in other places, all parents, all teachers, all child caregivers should know how to do CPR. And there are first aid courses. I know Dr. Ogunlewe is just giving you like an intro, and of course you need to practice. So it looks so simple the way she's saying it, but you really need to learn the course, you need to practice. So you can go online, search for first aid courses, for first aiders and things like that, and you must learn. But if you don't even want to go for courses, if you click YouTube videos, and I think we have a video on Ask the Pediatrician Facebook group as well, just watch the video and practice, and you will get to know it. So it's very, very important for us to know how to do CPR, especially in emergency. We've been talking about emergencies, and we've been saying that in emergency it's life-threatening. There is no time, and this is the worst emergency you can have, when a child has completely collapsed, the child is not responding, the child is not breathing, maybe the heart is not even there. So this is the worst emergency, and this CPR is a skill. And I'm saying every parent, every child, every parent, and even older children should have the skill to do CPR. So if you have questions, please kindly send your questions to us. Dr. Ogunlewe is here, and she will answer your question. Oluyemi, Stella is saying good job. Thank you for your feedback. Oluyemi Gabriel, thank you, doctor. Thank you for your feedback. Femi Owolabi is saying thumbs up, doctors. Thank you for your feedback. Okpe is sending us a thumbs up. Thank you. So Dr. Ogunlewe is here. Kindly send your questions about CPR. If there's anything you don't understand or anything you can do, please kindly send in your questions so that she can take it. While we're waiting for the questions, Dr. Ogunlewe, can you make it slower again? When do we do CPR? Another one, what shall we see in these children that will make you know that this is the time to do CPR? And I know you've said it, but I'm sure some parents have not caught it yet. So can you just slow it down for us in 1, 2, 3, or 4, 5, or in a slower point for us to know at what point do I need to do CPR? What child requires CPR? Thank you.
Okay, thank you very much, ma'am. Okay, so CPR should be done for any child who is unresponsive and not breathing. So as I said earlier, how do we know that a child is unresponsive? So I said, tap the child and ask, how are you? Are you okay? What is the problem? A child that can verbalize should be able to answer you, or the child should be able to open his or her eyes in response to your tapping or your questions, or you might even notice just limb movements. If the child doesn't do any of these, then the child is probably unresponsive. The next thing you need to check is the child breathing normally. So to assess breathing, I said there are 3 things that you can do. You listen and then you feel. So just look at the chest of the child. Is it going
chest
up
rising?
and down in a regular pattern?
Look
Is it
first.
rising up and down? So that's look. Number two, what you want to do is listen. So just bring your ears close to the child. Can you sounds that show that the child is breathing? And the third thing you want to, so bring your cheeks close to the nose of the child, movements on your cheek. And I said we can practice by putting our hands in front of our nostrils. Let's breathe in and out. We'll see that we can actually feel air movements on our palm. So if you do not see any of this, the chest is not rising, you cannot hear any sounds to show that the child is breathing, or you cannot feel any air movements on your cheek as you bring your cheeks close to the nostrils of the child, then that child is not breathing. So in all these situations, the child requires CPR.
And how long did you say we need to check for these signs of life for? How long should we check for? Should we check for 1 hour before we start confirming whether we need to do CPR? Sorry?
Like I said, it's an emergency. You only have seconds. I said, like I said, it's an emergency. 10 seconds to decide if a child is 10 seconds to decide if a child is unresponsive or not breathing.
And Dr. Ogunlewe, what I normally see people do in Nigeria is when a child collapses in school or things like that, they just go and carry buckets of water and pour on the child. Is that the appropriate thing to do before you start CPR? Should we be doing that?
Oh, definitely not. By the time you're even doing that, you're wasting time. Like I said, if a child collapses, it means blood and oxygen isn't getting to every part of the body. Pouring water on the child is not going to make blood or oxygen to flow around the body. What you need is CPR, which will temporarily help to pump and also give oxygen to every part of the body. So pouring water is not the solution.
Yeah, thank you so much. So my parents, our mothers, our fathers, and our teachers, when somebody collapses, a child, it could be even an adult, all these habits of us taking selfies or taking photographs is not going to help. All these habits of let's go and pour water, oh yeah, domiciliary, that is not appropriate. There's nowhere in medical practice in all my years in medical school where they ever taught us that when somebody collapses, when you pour water on them, they wake up. Please don't do that. What you need to do for them is what Dr. Ogunlewe just told us. You have 10 seconds to check for signs of life. Check whether the person is responding. If the person is not responding, check whether you can see that their chest is rising, that they are breathing. If you cannot see that, check, look, listen for whether there's any breath and or feel also for the breath. So if you can't see any signs of life, don't try and say, can I feel for the pulse? Because we watch Nollywood movies a lot, and in Nollywood movies, people, when they see somebody has collapsed or is dead, what do? They go feel for the pulse. That is not appropriate, because even in emergency, most doctors, you are so tense, it's difficult for you to feel a pulse, and except you are a medical professional who is used to feeling for pulses. For those of us that are lay people, what we are saying is that check whether the person is responding, check whether they are breathing. If you can't see any of those signs of life, commence your CPR immediately. And Dr. Ogunlewe has told us how to do CPR. So we have some question here. Okay, he said, kudos to the doctor. This Femi Owolabi. Please, you have not mentioned the cause of this cardiopulmonary. Can you please mention some of the causes? I'm not really sure whether Femi is talking about causes as per CAUSES, or is it a course that you can go and attend to learn about cardiopulmonary resuscitation? Okay, so since we are not sure, we're going to answer the question in both ways. So Dr. Ogunlewe, can you first tell us what are the things that will lead to a child collapsing that will now need the child to be resuscitated? What are those things that will cause that?
Okay, so as I mentioned earlier, some of the common things that can happen in children that may require CPR, I said, for example, choking,
okay,
drowning,
okay,
drowning, electrocution, electric shock.
Okay.
So those are some of the things that can actually cause a child to either stop breathing or become unresponsive.
Yeah, basically all the pediatric emergencies in children, which we have been talking about, this is the terminal point. Okay, so before every illness, every emergency in a child, why are we talking about recognizing them early? Is to prevent them getting to this point of collapse where the child has gone into what we call cardiac arrest. So the essence of all these conferences to make sure that our children don't get to the point where they have cardiac arrest or there's no respiration. Once we get to that, then that's like the step between life and death. If you don't do anything about it, the child is going to the other side. And that is why sometimes, this thing and children can progress rapidly. So sometimes we need to know what to do, because sometimes help may not come. So sometimes some of those emergencies are very sudden. Like Dr. Rena talked about aspiration yesterday. So children with aspiration can easily progress to cardiac arrest, and you need to resuscitate them. So basically all emergencies in children can end up with a arrest, and then we need to resuscitate them. And that is what. But if we are going to answer the question the second way, Dr. Ogunlewe, are there courses online or offline or face to face that parents can attend to learn about cardiopulmonary resuscitation?
Oh yes, there are. There are many courses that actually offer cardiopulmonary resuscitation for medical people. So if you actually go online and we browse for videos and a lot of courses that train parents, non-medical people to have skills in CPR.
Yes, so people, association like American Heart Association, they have what we call first aiders, and I know Dr. Ogunlewe, you mentioned about mouth to nose or mouth to mouth respiration. Some people are so scared of doing that because they are like, I'm not sure. I know children is easier, but even if it's an adult, it's still the same. So what do you say about that mouth to mouth? What if I'm the kind of person I don't want to put my mouth on somebody I don't know. What do you say to that?
Okay, but the thing is, it is really an emergency. And I know that many of us are afraid of getting infections, but the truth is, like, if you look at a lot of researches, it's been documented that rarely are infections gotten from mouth-to-mouth respiration. But what we can do, if we don't want to do that, we can put a cloth, a thin
Or an
cloth
handkerchief?
over the mouth of that child, breathe for the child. In some instances, if you are not comfortable doing that, then you can do what we call hands-only CPR, where you just continue the chest compression until help arrives.
Okay, so basically, just to rephrase what Dr. Ogunlewe said, if you don't, it's a good practice to carry around face masks. Those of us that are medical people, we usually have our own pocket face masks that we carry around. But if you don't have it, you can do mouth to mouth. The risk of infection is low, and it's a kiss of life. We're talking about saving somebody's life here, so it should not be an issue. But if it is still an issue for you, then like you said, you can use a handkerchief, cover the mouth and breathe into it, or you can just keep doing the chest compression only. You can just do cardiac compression only and leave out the breathing part. But in children, really, please breathe for the children, because for children, most of the arrests are actually due to the hypoxia, due to lack of oxygen. So they need the breaths more. And that is why when Dr. Gulewa was presenting for CPR for children, he said you should start with what? With 5 rescue breaths. So because children needs the breathing more. Thank you so much. Som Tochuku is giving us thumbs up. Thank you so much. Okay, Olawale Solomon is telling us nice talk. Thank you. Oladayo is asking, when do we do CPR? I think we've answered that question. So whenever a child is not responding, the child has collapsed. Basically, I'm sure you've gotten the answer. That's when to do CPR. Now, Dr. Gulewe, how long are we going to keep doing CPR for? Forever? Or what do we do?
Well, unfortunately, you have to continue CPR till train medical personnel or until you get to the hospital. So it's something that you have to do if you want the child outcome. If you are tired and the other person can actually do the CPR, but you must continue get to the hospital or until help arrives of keeping that child alive.
Okay, so just continue until helps arise. So hopefully if you are more than one person at the site, shout for help. And I think after 2 minutes, you said after 2 minutes we can go and shout for help as well, so that somebody else
If
can
you are
call.
alone,
Yes.
so what I said is, if you are alone, instead of running to actually shout for help first, do CPR for that child for at least 2 minutes before you call for help, and then you can continue. But if there are two of you, one person can call for help while start the CPR.
Okay. Dr. Gulewe, thank you so much. Can you please demonstrate for us again? Can you just do in 1 minute or in 2 minutes a circle of CPR? And can you try and make sure your rhythm is, I know you were talking and you were trying to just tell us, so it's okay. Before you do that, can you tell them the numbers again, because sometimes people get the numbers mixed up? So how many compression, how many breaths, and what is this, how do you alternate it? Just remind us again.
Okay, so for children, when you find them unresponsive and not breathing, the first thing you want to do is to give 5 rescue breaths. If the child is less than 1 year, you're going to seal the nose and mouth of that child with your own mouth and breathe in. So this is what you are going to do. For children that are less than 5 times before you start your chest compression, less than 1 year, for your locate the center of the chest just below the nipple line. So look, draw a line across that nipple line in the center of the chest. For children less than 1 year, you want to use 2 fingers. So just locate it, put it at the center of the chest, and you're going to do 30 chest compressions to 2 breaths. I always give your compressions at a rate of at least 100 compressions in 1 minute. So that's about 2 compressions per second. And I also mentioned that it is important that the depth of the compression is actually also important. It must be at least 1/3 to half the anterior posterior diameter of that child. So for a child that is less than 1 year, this is what you are going to do. So this is the nipple line, if you can see it very well. This is the center of the chest. Just put your 2 fingers. Your elbows must be straight. You don't want it to be bent to do an effective thrust. So it's going to go in this manner. If you are alone, 30 chest compressions. So it must be very fast and the depth must also be adequate. So if you can see me very well, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 30. And 2 rescue, seal your mouth around the nose and mouth of the child. And you do 2 are looking for the chest rise. If the child is more than a year, then use the heel of your palm, the same location, the center of the chest line. So for a child older than 1 year, you can do rate and the same depth, 1/3 anterior posterior diameter. So it's the same thing. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So there's no person in between. You're going to continue without lifting your hands from that child's chest. And you do that continuously until help arrives or until you get to the hospital.
Okay, thank you so much. I don't know whether there are people that still have questions. We still have some time now for us to take your questions. So send your questions. Thank you so much. There are people questions. Okay, can you send us your questions? Okay. Okay, we are almost done. Can you hear me?
Oh, okay, I can hear you now.
Okay.
I think I lost you for some
Yeah.
time.
Yeah, there was some issues, but we've sorted it out. Okay, but I think we are done with most of the questions, and I'm not sure whether we are live now. I'll just restart again.
Okay, well. Lose connection. Is it showing connect? Ṣé kí n sáré wá wò? Is there a connection? I think we've lost connection. We are not live again.
But I'm not sure people can see us. It's like we've lost our connection. I'm not sure whether we are alive. Hello, can you hear me?
Oh, yes, ma, I can.
Yeah, I'm not sure whether we are still live. Just a minute, let me just check on the page.
I think we are, because my brother is watching and he said he can still see me.
Ah, okay. So if we are still live, we are sorry for that. We seem to have some technical issues. So we're just going to round up quickly. We're very sorry. Seems like we lost our connection, but it's like we're still live. So if you are still watching us live, kindly just send us your final question. So I don't know what really happened, but sometimes we have some technical difficulties. So can you just send us your questions so that we know you can still hear us? I'm not so sure whether we are still live or not, but okay. So let's just round off, Dr. Ogunlewe. So what is your final word for our listeners?
Okay, so my final word for listeners this evening: CPR is an emergency, and it may mean the difference between life and death. The earlier you initiate CPR, the better the outcome for the child. Also, every individual, nanny, teachers, parents, siblings, everybody should be able to perform. We know that we could not really exhaust everything about CPR today. Every one of us to go on videos or even attend courses of skills in CPR. Courses to panic, it's not the time to it's the time to start. The child is on responsive breathing. Thank you very much for listening.
Okay. Oh, okay. I think people were still seeing us because I'm just going on live. Sorry, it seemed like in the studio we didn't know we were still live. I thought, well, we've lost you, but thank you so much for staying with us, and thank you so much for keep watching. Okay, so my last bit is to say thank you to Dr. Ogunlewe. It is a miracle that Dr. Ogunlewe is able to actually do this presentation today. I must commend her for
at the nick of time, just a minute or second
I must
before.
commend her for not giving up, because at a point I thought we will not be able to do it live. I thought she may have to come and do our traditional presentation where she just writes comments. But I can assure you there's no way you would have been able to see her do all this resuscitation for the babies and all that. So that's quite amazing. I'm so glad that she was able to do all the, I mean, she really put in a lot of effort, and I really want to say thank you so much. And I really appreciate you. And that is how pediatricians as, oh, okay, yes, okay, with all our issues have been resolved. I can see all the comments now. Thank you so much. Be live. They can now see us. Okay, thank you so much, all our viewers, for not going off. Okay, still waiting and watching. Thank you, Olawale Solomon. Thank you, Ayeni. Okay, I can see. I'm very sorry. I couldn't see you guys. I couldn't see your comments. So I thought I was offline, and I was trying to contact our hosting group, and finally they were able to. Oh, so thank you so much that you were seeing me all the time. I was trying to start it. Thank you so much for being persistent. Thank you for being a wonderful. Oh, so like I was saying, Dr. Ogunlewe, we initially thought she wouldn't be able to make it. There were a lot of technical difficulties, but I'm so grateful that she was able to make it. And I want to say thank you so much. Thank you for coming. And thank you for being such a great blessing to Ask the Pediatricians Facebook group. And she's also one of our volunteers and as our professional on the group as well. So thank you so much. And thank you to all the people behind Dr. Ogunlewe, because I see a lot of behind the scene crew members doing a lot of working and making sure that she could go live. I'm really very grateful to everyone behind there, our production crew behind Dr. Ogunlewe. Thank you so much for your support. We really enjoyed the presentation. Thank you so much. Okay, so Dr. Ogunlewe, thank you so much. I'm happy that we didn't lose it completely, and I was happy that even the time I thought we were not seeing you, you were still live. So that's quite interesting. That's very good. So thank you so much for coming, and have a wonderful night. All right. So everyone who has been watching, thank you so much. And this brings us to the end of our Ask the Pediatrician anniversary conference. It has been so wonderful. Oh, I can still see people bringing in questions. Okay, because we lost you briefly, I'm going to just take all the questions that are left. Okay, AMSAT, I think Dr. Buki already answered your questions, so that has been answered already. AMSAT, Dr. Buki said you should. Let me just show the question for those who are wondering what question am I talking about. So Dr. Buki has said that you can go and see a dentist, and maybe most likely your child has a form of malformation of that teeth, and that the child needs to see a dentist in short. Okay, so it has been a wonderful time on Ask the Pediatrician. We've had 2 amazing days of discussing pediatric emergencies, and we started yesterday. And for those of you that mixed the one, the videos are still available for you to watch on our Facebook group, our page, and our YouTube channels, and I'm sure you will learn so much. In fact, we actually started on Sunday, and I give the keynote address and I give an overview of what are pediatric emergencies. And I'm still going to reiterate, why do we decide to handle pediatric emergencies during this online conference? We know that Ask the Pediatrician, basically, we don't answer emergency questions, because by definition, pediatric emergencies are life-threatening. They are things you must do something about immediately, and if you don't do anything about it immediately, it could end up to the stage where you will need to start doing CPR, which Dr. Ogunlewe just tell us. But we as pediatricians, we know Dr. Ogunlewe was just focusing on practical aspect, which is what I really wanted her to do. But do you know that even with CPR, pediatric CPR, the success rate is so low? In other words, maybe only 2% of children will be successfully resuscitated. That is how bad. In other words, even despite all the CPR, but then even that 2% is still something. So we want you to know how to do CPR. But the point is, we don't want the children to get to the point where you need to do CPR. We want them to be taken to the hospital fast, because if you bring them to us early enough, we can do something so that they don't get to the stage where we need to do CPR. And you all know, and for some of my listeners, you know what it is. By the time you see doctors doing CPR in a child or in the hospital, you all know that this is now 50-50. You know, luckily God has been good to us. We've been able to bring back some children, but sometimes we are not so fortunate and we lose those children, and it's always very painful for us. So we don't want these children to get to CPR. We don't want to get to the state where they collapse, where they are not breathing, or where they're in cardiac arrest. We want them to come to the hospital early. And if there's any one single message that I want you guys to take home today, it is the fact that when children are ill, when you've seen any of those emergencies, we've talked about many of those emergencies, please and please don't ask on HCP. Please and please take the children to the hospital. That is a single message. If you don't take anything away in the last 3 days, we've started HCP conference, take away that when there's an emergency, it is life-threatening. An emergency means you need to do something immediately. It is now or never, and that is the definition of emergency. Something life-threatening, you need to do something, and you need to take the children to the hospital. So I started with the overview of what an emergency is on Sunday, and we've had speakers. So Dr. Oge has spoken about pediatric surgical emergencies. Please watch the videos again. Look at all the symptoms. We try to make it simple. We try to keep it very straightforward so that you can recognize it as parents and know when to take children to the hospital. And that's what Dr. Oge did about pediatric surgical emergencies. Dr. Uche talked about the newborn, because virtually everything in the newborns are emergencies. Everything. You can say that, because any illness in the newborn can progress very rapidly. So they are not the time for you to say, oh, let's do the naming ceremony first. After naming ceremony, we'll take the children to the hospital. If you do that, you may have that may be death. So that's why we decided to talk about the newborn emergencies as a separate entity. And Dr. Uche took her time yesterday to tell us about the different things, including jaundice. Even, newborns may not have the dramatic things, but yes, things like fever in the newborns, things like jaundice in the newborns, things like the newborns not being well, sepsis, they are emergencies and they needed to be treated quickly and immediately. So please, newborns, and I was mentioned yesterday that for newborns, kindly take them to see the pediatricians. I'm not even saying to go and see just any doctor, because sometimes they want to treat them like adults, which they are not. So please and please take them to the children emergency. And please stop telling us that the hospital is too far. When it comes to life-threatening emergencies, there's no place too far. If you are worried, call the ambulance. Even in Lagos, you can call the ambulance anywhere, or just go to the nearest hospital to you. Even if it's a private hospital, let them start something, and then they can refer the child on to the children emergency room if necessary. And then we've talked about aspiration, and we talk about aspiration of foreign bodies, aspiration of food. Please, no force feeding of children, no foreign body. Don't give toys to children that have small parts, especially children below the age of 3 years. Avoid giving them toys that have small parts. I'm just summarizing all that we've been talking about in the last 2 days, and these are very, very important things, so that we pediatricians, I always tell people think, oh, doctors always pray that they will have patients so that they will make money. I can tell you that we pediatricians, we don't pray that prayer. I can tell you that our prayer is that those children will never be sick, because we pediatricians, we don't need children to be sick to make our money. We don't need it, because we have enough work to do with the healthy children, not to talk of the sick ones. In other words, we have enough work to do, making sure the children are eating, making sure they are growing, making sure they are developing, making sure they are getting all the immunization. So we have enough work to do with even the healthy children who are not sick. So we are not praying for sick children. So please, we want the children alive, we want them healthy, we want them achieving their potential, and that's why we're emphasizing these things, this message. Please take this message very, very seriously. No force feeding of drugs, no force feeding of food, no giving toys. And if you notice anything, please go to the hospital. Dr. Rena has shared the videos with us how to relieve a child who is shocking. And also, let me just say that if a child is shocking and the child has collapsed, then you switch from all those back slap and abdominal thrust, you shift to the CPR. That's what you do. In an unconscious child, it is CPR. It is in a conscious child that you do the back slaps, and so that maybe the foreign body can be dislodged. And that's what we did yesterday. And today, Dr. Buki OLATOSI has talked to us about the pediatric dental emergency. So all those pictures of broken tooth, aversion of tooth, or dental abscesses, she has told you what to do. Please, you can still watch this video after this time. So those are the things that we need to do. And also, Dr. OLIBAMOYO talked to us about poisoning, and she has talked to us. Apologies for some of the poor audio, but eventually I'm sure we got the message. So when children have taken the wrong thing, they've taken poison, please don't force them to vomit. Don't give them palm oil. Don't do any of those things. Please take them to the hospital, because in the process of saying you're trying to help, you're actually creating more problems for us. And at times it is even the extra your help that is causing more problems. And we also talk about burns as well yesterday briefly. And finally, Dr. Ogunlewe has rounded it up for us by talking about resuscitation, cardiopulmonary resuscitation. And I plead with every mother, go and watch this video again, because she demonstrated it for us. If you can also watch CPR videos on YouTube, on our Facebook group, we have it there, and you can go for courses. You should, in fact, those of us that are teachers, those of us that are nannies, those of us that work with children, it is compulsory that you should know you should be a first aider. It's important that you are a certified CPR provider. You could do CPR. It is very important, because you never know when a child will collapse. And when children collapse, please, all this attitude of us pouring water on them, pouring this, pouring that, please, can we stop it? You have not saved the child. In fact, you could have even worsened the problem that the child is having. So when a child collapses, what you need to do is not to pour water on them. It's not to start shouting, egg by me, running up and down. Those are precious time that you could use to help save that child's life. Don't pour water. And when you go around, you see it's happening, don't take control of the situation. No panic. I think almost all our speakers have said it. No panicking. I know it's it's a tall order, but try and just be calm, because you're being all the panic, all the running, all the screaming, all the shouting. It's not going to save the child. Maybe it can attract help. And unfortunately, what people do now is to crowd around a child who is dying, a child who needs oxygen. People will now gather around and consuming all the remaining oxygen that the child needs. So what you need to do is say, okay, everybody step away, you call the ambulance, then you can start, look, is the child responding? If the child is not responding, is the child breathing? If the child is not breathing, you can look and see whether the chest is rising. You can feel, you can listen for breath. If you can't see anything, start CPR shot. So you give 5 rescue breaths, then 30 compressions and 2 breaths. You can do mouth-to-mouth resuscitation. Your risk of getting HIV or infection is very minimal, so don't be scared. And if you are really the scary type, or maybe you are just the people that easily get irritated, just get a white handkerchief. If you're a health professional, you can carry around your pocket mask so that you can use a face mask, put it on the child and start breathing for the child. It could make a difference between life and death. And people can sometimes recover, and then, of course, the health professionals will take over. So basically, this is what we've been talking about in the last 3 days on Ask the Pediatrician. So we don't want to be seeing questions that are emergencies on ATP. It's not as if we don't like answering a question, but it's a pain to us when we see that the time it will take you to type on Facebook may be the time that child needs to just get the right treatment at the hospital. So when a child has an emergency, maybe what you need to do, maybe what we will also do at the end of this presentation is to come up with a list of, when you see these things, please take that child to the emergency room. Don't even type on Facebook. You can come and tell us the testimony afterwards, but please take the child to the hospital. That is the message that we're passing around, because on ATP we are there to answer your questions. We support the children, but it's an health education group, it's an information group. It is not about we can't treat your child. I can't examine your child on Facebook. I can't ask. Sometimes many parents don't understand that the question that a pediatrician needs to ask to make a diagnosis is not one line. If you've seen pediatricians do a history taking, sometimes we are writing 2 pages. And so you will give me 2 or 3 lines on Facebook and you think I will make a diagnosis with that. It is not possible. And then after taking that 2 pages of history, I'm still going to touch that child. It is after doing all that. Sometimes I still need to do tests and investigation. It is after all that I can now make a diagnosis. So when people ask questions and they say, doctor, what should I do? They don't, some of us will just smile because we know that it is not as straightforward. Some cases are straightforward, but we can tell you what to do. And when we now tell you, please take the child to the hospital, please don't get angry, because sometimes that's the best answer that we can give you in that scenario. And so that is why we've decided to bring all our experts to talk to you, and especially for the emergencies, because the emergencies are the things that kill our children. And children see that a lot. 1 million child deaths over under 5 every year. That is a lot. And 40% of these deaths in the newborn. That is a lot. And especially for those of us who are living in Africa, in third world, we're losing all our children, and these deaths are too many. And what ATP is trying to do is that we don't want our children to die from things that are preventable. We don't want children to die from diarrhea. We don't want children to die from pneumonia. We don't want children dying from malaria. And we don't want children. And the reason why these children die is because they gave us enough sign, but we didn't react to them. We didn't take them to the hospital. And then when they get to the emergency state, we run. Sometimes you come to the hospital, there's nothing the pediatricians could do anymore. There's no magic that we could perform anymore. But if you have come to us when the children are still quite giving us enough time to do what we can do, then the chances that the children will survive will be better. I know this is a long talk, but I just want to round up and also just say thank you to everyone who has been part of this anniversary conference. Thank you so much to all our speakers, Dr. Oge Idika, Dr. OLIBAMOYO, Dr. OGUNLEWE, Dr. Uche, Anela Nzelu, Dr. Rena, and Dr. Buki OLATOSI. And thank you so much to all our moderators who have been helping us with making sure the questions appear on the page. I want to say thank you. And this is just to say that this is not the end of our anniversary week. LTP is going to be 3 on the 20th of July. That's actually our anniversary day, but we're celebrating for the whole week. And tomorrow is going to be our anniversary LTP babies of the year. And so all the babies that have entered into the competition, we're going to put down the pictures, and all you need to do is to vote for them. And we're going to have a winner for the male category. We're going to have a winner for the female category. And we're going to also give gifts to the best 10 babies. In terms, it is you guys that are going to decide who win. So it is based on your votes. Those who have the highest votes will become the winners. So please, I want to beg all of us to make sure that you vote for the babies on Ask the Pediatrician Facebook group from tomorrow. We're going to leave it up for like 48 hours and kindly vote for them. And on Thursday is our quiz, and the quiz is going to be 2 parts. You're going to have the first part where she's going to be via a Google quiz, and everybody can click on the link, answer the questions, and the best 10 will now do the round 2, and we have lots of lovely gifts for our winners. So, and we are going to do this round 2 live as well, so make sure you join us at 6 p.m. on Thursday. Friday, we're going to have our recruitment campaign. If you want to be part of what ATP is doing, you're welcome to be part of it. So, and like we said, there are many ways you can join ATP. You can be a moderator, you can be a financial partner, or you can also be a medical outreach volunteer. So if you want to be part of our team, we welcome you wholeheartedly. And so you can join us on Friday. We will tell you everything you need to know on becoming part of Ask the Pediatricians Foundation. And then on Saturday, we're going to have an open house, and I will be here, and I'm ready to answer all your questions. Now on Saturdays, no holes, but no barrier. You can ask me any question, medical, non-medical, anything under heaven is allowed. So we're going to just talk about ATP. We're going to talk about everything we are doing. So it's going to be a wonderful time. And then on Sunday, we're going to have our party. So we want to encourage you to be part of our anniversary. It's been wonderful being here. I personally have learned a lot during this conference, and I hope that you have learned. Kindly share the videos for your friends so that they too can be part and they can learn. And so on this note, I'm going to sign out, and I'm going to say thank you so much for watching Ask the Pediatrician Live, and we hope to see you on Thursday during the quiz. Thank you so much. Have a good night, everyone. Bye.